digital solutions designed to reduce mortality rate here in Ghana. And so I would want to tell you that your presence here this morning is very, very important. And I know that with your collaborative efforts, we are going to have a very successful event. I understand that there were over 100 applicants. There were some procedures and processes, and today we have trickled down to 12 exceptional finalists. I wouldn't want to go into the nitty-gritty. At the appropriate time, someone well-placed will come and do the explanation for us. And so at this point, we would start with an opening prayer. It is conspicuously missing in the agenda, but we would have to do that. My lady looking at me, please, kindly do us the honors by saying the opening prayer for us. Standing right behind Estelle.
Shall we pray? Shall we bow down our heads and pray? Our dear Lord and Master Savior, we ask you to be in our presence this morning. We commit this program into your hands. We ask for your grace that sustains, that saves, that provides the needed support to be with us this morning. We put the whole agenda into your care. We take absolute control of this session till we close from here. And at the end of the day, we wouldn't hesitate to give you thanks and glory. We commit our participants, our juries, everyone that matters into your care this morning. This and many more of your blessings we ask in Jesus' name. Amen.
Amen. A round of applause for her, please. I put her on the At this point, I would want to introduce some key personalities in our midst here this morning. And we have Director in charge of Technical Coordination here at the Ministry of Health, Dr. Hafiz Adams. Thank you so much, Doc, for coming. We also have the Administrative Head of the Ministry, I mean the Chief Director of the Ministry of Health, Mr. Desmond Boateng. I would also want to acknowledge here Madame Paulina Adomako, DNMS CCTH. You give us a wave. We have here, there are no titles. In fact, you have here Madame Adraina Kessie, Acting CNMO RHD, Ahafo. We have here Mr. Kennedy Japan. Forgive me if I couldn't mention it well. That is what I'm seeing here. DNS, Ghana Police Health Service. Dr. Mary Idrisu, Lecturer, School of NSG, University of Ghana. Colonel Francisca Amachi, DNMS, GAF, Ghana Armed Forces. Dr. Gloria Achempem Anson, Director of the Ghana, let me go by what I'm saying, GCNM. And then we have here Madame Christiana Esi Ankra, CNMO, Bono, RHD. And then Professor Veronica Jomeku, Lecturer, Kwame Nkrumah University of Science and Technology. We highly acknowledge your presence here this morning. Thank you so much for coming. To set the tone for today's event, we'll receive a welcome address by the Chief Director of the Ministry of Health. A resounding round of applause for Mr. Desmond Boateng.
Thank you very much, MC. And once again, good morning to everyone. I hope you're all doing fine. Okay. So I just have a simple task, and that is to give us the welcome address. And so I'll proceed to do exactly that. Dr. Chairperson, directors of the Ministry of Health, representatives of the other sector ministries, directors of nursing and midwifery, chief nursing and midwifery officers, UNFPA country reps, principals of nursing and midwifery, midwife innovators, distinguished invited guests, ladies and gentlemen. On behalf of the Ministry of Health, it is my pleasure to warmly welcome you to the inaugural Midwives Innovation Hackathon. We are grateful to see representatives from the Ghana Health Service, the Nursing and Midwifery Council, professionals associations, academia, development partners, and all valued sponsors. Above all, we extend a very special welcome to our dedicated midwives whose tireless efforts continue to safeguard the health and well-being of mothers and newborns across the country. Midwives remain central to the delivery of essential maternal and newborn care and are key to advancing Ghana's universal health coverage agenda. However, recent data from the Ghana Health Service highlight persistent challenges. The 2024 report recorded a marginal increase in institutional maternal mortality, neonatal mortality standing at 5.17 per 1,000 live births, and a decline in skilled delivery coverage from 60.6% in 2023 to 55%. These indicators call for innovative and scalable solutions that address the practical realities faced by midwives every day. It is in this context that today's hackathon is both timely and strategic. Under the theme, Innovation as a Catalyst for Maternal and Neonatal Health Excellence, this platform empowers midwives to generate, design, and prototype solutions that can enhance efficiency, improve clinical decision-making, and strengthen service delivery. By transforming frontline challenges into creative interventions, we take a significant step toward improving outcomes for mothers and newborn nationwide. On behalf of the Ministry of Health, I encourage all participants to engage fully, collaborate openly, and think boldly. The Ministry remains committed to supporting initiatives that elevate midwifery practice and contribute to achieving Ghana's national and global health targets. Once again, I warmly welcome you to this important event. We look forward to a productive and inspiring engagement. Thank you very much for your kind attention.
I think we can do it better for the Chief Director. Thank you so much, Chief. At this point, we would have an address by the Deputy Country Representative of UNFPA in the person of Madame Emily. Okay. I understand she's not yet here. And so we will take an address by Madame Neta Akon Forsen. She is the president of GRMA. A round of applause for her, please.
Thank you very much, and good morning to all of us here. My address is pinned to the theme that was sent me, the midwife's perspective, driving innovation from the front lines. So standing on existing protocols, I find it a profound honor
to stand before you today on behalf of the Ghana Registered Midwives Association as we reflect on and celebrate the transformative power of innovation in maternal and newborn health care. Today's theme, the midwife's perspective, driving innovation from the front lines, speaks not only to our aspirations, but to our lived reality. It captures the essence of midwifery in Ghana: practical, resilient, creative, and deeply committed to the well-being of women and families. Every day in Ghana, midwives undertake one of life's most vital roles, that is ensuring the safe journey of mothers and newborns through pregnancy, childbirth, and the postpartum period. This sacred duty is performed in various settings: busy regional and district hospitals, peri-urban health centers, remote CHIPS compounds, maternity homes, and improvised community spaces where a midwife might be the only skilled provider present. However, the landscape of healthcare is changing rapidly. We are facing rising maternal health demands, shifting demographics, economic pressures, public health crisis, and the serious impacts of climate change. These issues require new ways of thinking and innovative methods rooted in practical experience. And who is better suited to lead in such innovation than the midwife, who is the frontline practitioner, the first responder, the counselor, the health educator, the researcher in the field, and the advocate in the community. Today, we honor midwives not just as caregivers, but also as essential agents of change. Midwives have always been pioneers long before innovation became a catchphrase. Their ingenuity arises from necessity. In remote communities such as those in the Savannah and Oti regions, where poor road networks and long distances hinder access to health facilities, midwives improvise transportation, coordinate community support systems, and employ creative referral strategies to save mothers in distress. In busy urban hospitals overwhelmed by high caseloads, midwives develop workflow systems, triage strategies, and team-based care models to reduce delays and improve patient safety. And in CHIP zones, midwives adapt care protocols to manage weather disruptions, limited equipment, and socio-cultural barriers, demonstrating that innovation is not just technology, it requires ingenuity. Their constant problem solving is the foundation of Ghana's evolving maternal health care system. There are some frontline experiences which inspire innovation, and they may include the following, but not exhaustive. The first is when there is public health crisis. In a situation of the COVID-19, which is very recent in our minds, this COVID-19, when it happened, the pandemic, really tested our health system in the country, but it also revealed the extraordinary resilience of our midwives. With PPE shortages, movement restrictions, and heightened community anxieties, midwives innovated rapidly as they reorganized antenatal clinics into smaller, safer groups. They conducted remote consultations using basic mobile phones. They intensified community awareness campaigns on hygiene and safe pregnancy practices, as well as redesigned labor and delivery protocols to protect mothers and staff. This adaptability saved lives and ensured continuity of care at a time when fear itself became a significant barrier to accessing health services. The next is innovation during disasters and climate changes. Climate change hampers health service delivery in many parts of Ghana. For example, when there are floods, it isolates villages, drought limits access to water for hygiene, and unpredictable weather causes more displacement. Yet, midwives endure. During these difficult circumstances, midwives helped establish temporary maternal care points, delivered emergency services, and ensured newborns received vital care even in makeshift environments. Their experiences show that innovation must now incorporate climate resilience. And the third example that we have is that midwives often serve as a link between the health system and the community. They develop culturally sensitive counseling approaches, family involvement strategies, school-based productive health sessions, and community mobilization campaigns. And the success of the CHIPS system itself that we have in Ghana is one of Ghana's most celebrated innovations, which heavily depends on the ingenuity of midwives who provide skilled care directly to women's homes. Digital transformation is reshaping healthcare worldwide, and Ghana must keep pace. Midwives are already leading this wave of change. They have assisted in piloting digital maternal record system, telehealth consultations, SMS antenatal reminders, and mobile applications that monitor danger signs. With proper support, midwife-led digital innovation can 1. Strengthen community continuity of care, 2. Streamline referrals, 3. Prevent delays in emergencies, 4. Improve data accuracy, and 5. Enhance decision-making at the facility, district, and national levels. These are opportunities waiting to be expanded through investment and collaboration. Innovation must also focus on the well-being of midwives themselves. Burnout, trauma from emergencies, staffing shortages, and the emotional toll of care can undermine performance and lead to increased turnover. We must innovate around 1. Supportive supervision models, 2. Mental health screening tools for midwives, 3. Peer support systems, and 4. Technology-supported counseling services. A thriving midwife, it is said, delivers better care and drives greater innovation. Distinguished guests, innovation does not occur in a vacuum. It requires financial support, technical expertise, policy alignment, research collaboration, and incubation platforms such as what we are seeing today. Already, many of you here representing government, NGOs, private sector communities or companies, universities, and digital innovators have demonstrated a deep commitment to maternal health. GRMA is very grateful for that. Yet, the needs are still significant. We require your continued partnership to be able to, 1, strengthen midwife-led research and development, because midwives must not only implement innovations, they must also design them. 2, expand stimulation-based learning and emergency skills development, because every midwife should have access to high-quality practical tools, including simulators for emergencies like breech delivery, postpartum hemorrhage, and neonatal resuscitation. 3. Connectivity. Enhance digital inclusion for midwives because connectivity, devices, and training must become standard for frontline providers. And 4. Support climate-resilient maternal health services through the use of solar-powered equipment, mobile clinics, and adaptable emergency systems that can help maintain continuity of care during disasters. If we are able to establish innovation funds for midwives, it will also help to have a dedicated fund that will empower midwife innovators to develop scalable solutions. Innovation in maternal health also requires multi-sectoral collaboration as the only way forward. We need technology firms, universities and research institutions, public health agencies, private health care providers, philanthropic organizations, insurance companies, local governments, and most importantly, midwives themselves. No single actor can solve systemic challenges alone, but together we can build a stronger, more responsive, equitable maternal health care system for Ghana. The GRM's vision for midwife-led innovation is that we want to see a Ghana where every midwife is equipped to innovate. We want to see a Ghana where maternal deaths are rare, not common. We want to see a Ghana where technology connects midwives to specialists seamlessly. We want to see a Ghana where rural mothers receive care equal in quality to that in urban hospitals. We want to see a Ghana where midwives are recognized as leaders in national health policy and emergency response. This hackathon and today's gathering are part of a much broader GRMA commitment to empowering midwives as innovators and change makers. In conclusion, ladies and gentlemen, if there's one message we hope you take from today, it is this. Midwives are not just part of the health system. Midwives are the system for thousands of women every day. Their perspectives shape innovation. Their actions save lives. Their ideas can transform the future. But their full potential will only be unlocked through meaningful collaboration, targeted investment, and sustained support. As we move forward together, GRMA, sponsors, stakeholders, and innovators, let us build a future where midwife-led innovations inspire the next wave of breakthroughs in maternal and newborn health. On behalf of the Ghana Registered Midwives Association, I extend my heartfelt appreciation for your presence, partnership, and shared commitment to improving the lives of mothers, newborns, and communities across Ghana. Let us continue to innovate from the front lines together. Thank you very much for your attention.
Thank you very much, Madam President, for that insightful address. Ladies and gentlemen, before we continue, I would like to introduce to us more dignitaries who have joined us. I would want to introduce Dr. Pearl Nanka Bruce, who is the Country Director of JAPIGO. You are welcome, Doc. We have been joined by two directors of the ministry, and I'm delighted to introduce to you Dr. Ignatius Arinibono, who is the Director in charge of Allied Health here at the Ministry of Health. You are welcome, Doc. We also have here Dr. Ernest Esiedu Kunedu. He is also in charge of medical and dental here at the Ministry of Health. Thank you so much. We also have here Madame Eunice Opon Amoa, the acting DNMS Sunyani Technical Teaching Hospital. And then we have Dr. Emily Sandra Nafambo, the Deputy Country Representative of UNRPA. Hey, the handwriting. I blame those who wrote this for me. And then we also have here Dr. Jemima Dennis Inchi, CEO of CEHDAR. Said that right. Thank you so much for joining us, Mom. Okay. So before we proceed to the agenda, we are privileged to have someone who brings remarkable insight and strong commitment to today's event. And so I'm elated to introduce to you our chairperson for today. And he's also ably representing the Honorable Minister for Health, Mr. Kwabena Minta Akando. And so we have here a public health specialist who is also currently Director for Technical Coordination of the Ministry of Health. He's also the chairman of the Intra-Country Coordination Committee for Neglected Tropical Diseases in Ghana, and under his leadership, Ghana eliminated human African trypanosomiasis. He also chairs several technical working groups related to neglected tropical diseases and non-communicable diseases. Before becoming the Director of Technical Coordination, he served as the Chief Program Officer for the Ministry's External Health Corporation. Before that, he had served as the National Coordinator for the Lavicidin Project for malaria and other vector-borne disease control. He's also a board member of the Pharmacy Council, as well as a board member for the Kumasi Center for Collaborative Research of the KMUST. He has been part of several high-profile delegations, locally and internationally, and he speaks several international languages, including English, Spanish, French, and Arabic, in addition to local Ghanaian languages. Distinguished ladies and gentlemen, with a resounding round of applause, help me welcome Dr. Hafiz Adams. Doc, would you want to come here, or you want me to bring the microphone to you? You come. You come. All right.
Thank you very much, Madam MC. I am humbled by those words about me. And when you were saying that I speak several languages, I was shivering. And at an interview, somebody presented his CV. He had indicated how well versed he was in the local languages. So the chairman of the committee was so happy. And when he sat down, he said, Aiko. So the expectation was that because he is well versed, he would have responded appropriately. But when he said Aiko, his answer was cool. On this lighter note, ladies and gentlemen, I'm humbled by my choice to spearhead this morning's important gathering. I will say that I will be serving rather as a messenger, because the caliber of people here suffice it to say that I don't think I will need to do anything. The only thing I ask of you is to support me, go through all the programs, because in many cases, from the beginning, you see a lot of people actively participating. As time goes on, by the time you realize you are counting half of the number of people, I hope that it will not be done here. So on this note, ladies and gentlemen, I thank you for my choice as a chair, and I require, as I said, your support. Thank you very much.
Thank you, Dr. Chair. We will proceed with an address by Dr. Emily Sandra Nafambo, the Deputy Country Representative of UNFPA. Let's welcome her with a round of applause.
Good morning. Good morning.
Good morning.
Let me begin by apologizing. I think the people who made me late, they're quite in this room, and I do hope that you make them pay. Because I got into the office this morning and I said, we have a hackathon. They said, no, it starts at 9:40. I said, no, it starts at 8:30. And then when I didn't show up, they were calling me, telling me that you're supposed to speak. I'm like, but I asked in the morning, but please, I'll show you at the end of my remarks. The chair of the event, Prof. Adams, it's always difficult to speak after you because you already have made the group already laugh a lot. The representative from the Office of the Minister of Health, the Chief Director in the Ministry, Mr. Boateng, representatives from Ghana Health Service, all the directors and heads of agencies present this morning, development partners, but also our sister agencies from the United Nations, principals and heads of our nursing and midwifery training centers, the heads of professional bodies for nurses and midwifery, distinguished partners, members of the media, ladies and gentlemen, all protocols observed. Before I speak, I would like to say that UNFPA means United Nations Population Fund. Every time I try to speak, I try to correct it because others say it's UNFP, others say it's UNIFPA, and today I had another version. So it is UNFPA, and greetings from UNFPA this morning. My representative, Dr. Wilfred Ochani, wanted to be here this morning, but today it's a busy day. There is a masculinity conference happening as I'm speaking, of which half of this room was supposed to be there. So all the men were supposed to be in that conference, whilst the rest of us are supposed to be here for the hackathon. But to balance the tables, he decided to join the other men so that I can also stay here with the other men and the other ladies. So please forgive him for this morning. It is a pleasure to join you for this Midwifery Innovation Hackathon organized by the Ministry of Health in partnership with UNFPA and other partners. Let me begin by commending the Ministry of Health and all partners for bringing together the midwives, young innovators, technology actors to co-create solutions that will strengthen maternal health in Ghana. We do acknowledge that here in Ghana, some declines have been seen in maternal mortality over the past 2 decades. We know that the maternal mortality ratio moved from 386 deaths per 100,000 live births in 2007 to 310 live births by 2017. Substantive interventions and investments
including what the earlier speakers alluded to, the investments in the midwifery to ensure skilled birth attendance, but also investments in free maternal health care under the National Health Insurance Scheme have contributed to this reduction. However, as we all know, the situation remains dire. Ghana recorded 806 maternal deaths in 2022, 867 deaths in 2023, and as of November 2025, over 900 women had already lost their lives. This data is as reported by Ghana Health Service at the Maternal and Newborn Scientific Conference that happened a few weeks ago. As you agree with me, this is not okay. Given such high maternal mortality rate ratios, but also these fearful absolute numbers which have been observed over the years, an intentional and accelerated rate of decline is needed for the country to position itself to further reduce maternal mortality, but also possibly achieve the Sustainable Development Goal MMR target of 70 per 100,000 live births by 2030. These deaths should compel us to do things differently. These deaths should renew our commitments, should strengthen our leadership, but also should compel us to embrace innovation as a critical pathway to reversing this trend. We all seated here acknowledge that we cannot continue doing business as usual. We certainly need to think differently. This hackathon is therefore timely, but also urgent. Reducing maternal mortality in Ghana requires new thinking, digital tools, but also context-appropriate solutions grounded in the realities of our midwives who are actually working on the ground. In UNFPA, innovations in programming is a priority. We truly believe it. It is the only way to enhancing our programming capabilities. Our focus is quite clear: leveraging technology for better health outcomes, empowering young innovators, strengthening Ghana's innovation ecosystems, and also scaling up solutions that deliver real impact for women and girls. UNFPA always stands ready to work with the Ministry of Health to nurture the most promising solutions and support pathways of piloting, but also scaling up innovations. I cannot say it better than the previous speakers. Midwives are at the heart of this work. The lived experience, the insights, and the leadership make innovation meaningful but also effective. But we also acknowledge that innovation cannot happen in isolation. It thrives through partnerships across governments, across the private sector, academia, youth groups, but also development partners. Today is a testament to the power of collaboration in enhancing maternal health. UNFPA Ghana reaffirms our full commitment to supporting the Ministry of Health through digital transformation, capacity strengthening, but also youth-led innovations, and generally thinking outside the box to improve maternal and newborn health. To the innovative midwives, be bold and design for real impact, and let your voice guide the solutions you build. To all the partners, let us continue strengthening Ghana's innovation ecosystem for maternal health. I personally look forward to today. I cannot wait to boast about the great work that I shall see today, but also to say aiko and thank you all for your attention. Medasipa.
So up next is a presentation on health system strengthening, linking digitalization, technology, and AI to maternal, newborn, child health outcomes. And this will be done by Professor Samuel Ajololo. A round of applause for him, please.
Good morning. Please, can I have my projection? Mr. Chair, I'm standing on the existing protocols. Because of the reasons for the gathering, I don't think we should spend some other time. But being a teacher as I am, it's always a privilege to share briefly what my thoughts are through presentations. But if it's going to happen, let me know. Otherwise, I'll go on. The earlier speakers have said a lot about maternal and newborn health in Ghana. But for me, my proud moment is the innovations that we are here to witness today. In 2001, several years ago, I was privileged to be admitted to a Norwegian school to study a course called telemedicine and e-health. I didn't know what that animal was. And then when I tell people that I'm studying telemedicine, the question is, what is that? What are you going to use that thing for? At the point, I was overly discouraged. I felt that I was wasting my life. So on one vacation, I came down to Ghana and I went to the ministries to speak to some few people. In fact, I didn't see the insights that I was expecting to actually see. Yes, thank you. I didn't see, can you go to next slide, please? Yes. I didn't see the insights that I was expecting, but I didn't give up. So as part of the course, we were to design a hospital or design a healthcare system for the year 2020. And it was a group work. So myself and my other colleagues came up with a solution for midwives that they can use in promoting maternal health in 2020. That was somewhere in 2011, 2012. So there was a Vision 2020, which today I'm happy that we are witnessing what is happening now with regard to our midwives and students. At the University of Ghana, when I came, we decided to be different from other institutions. And so we revised our curriculum, both at the undergraduate and also at the master's level. And one thing that we incorporated was telemedicine, nursing informatics and telemedicine. These structural changes expose our students to some elements of technology and healthcare delivery. So at the MSc level, next slide. At the master's level, we gave an assignment to our students to also envision a healthcare delivery system for either nurses or midwives. And what you see on the screen are what two groups or two students actually presented as their vision or anticipation when it comes to providing healthcare using technological devices and tools. So clearly, we are on the right path as a nation, especially that academia is showing interest in exposing students to some of these innovations and ideas about how to do things differently. Next slide, please. Next. Yeah. So I wouldn't spend time saying what has been said already, but to take us to the fact that digitization is the way to go, and I really wouldn't spend time. We all know what it is. But some pressing challenges we have in the system currently make it more compelling for us to use digitizations in our healthcare delivery systems. First is delayed detection, weak referral systems, limited tools for early risk identification. But these are areas where technology can actually support us. And in particular, I am impressed with decision support systems or decision support algorithms that uses threshold indicators to prompt healthcare indicators as healthcare workers as where to intervene and when not to intervene. So over the years, there's been a lot of technological advancements in healthcare delivery, and these are intended to address these problems, but more crucially, to enhance data collection and reporting, which is crucial in the care that we deliver. Two, to facilitate real-time monitoring. So it is not asynchronous, but highly synchronous so that we can understand what goes on. But also to enhance better communication, which has been identified as one of the pitfalls that contribute to delays in healthcare access for most people. Next slide. So there are a lot of ranges of digital tools in maternal and newborn healthcare delivery, from mHealth all the way to wearable devices. And truthfully, as a nation, there's a lot of dividends if we begin to embrace some of these strategies and empower our young ones to actually move the drive. Next slide. We always hear about AI, which is artificial intelligence. This is a unique future, not to replace human thinking, but to augment or complement human thinking. And sometimes, for those of us who are still in school, if you like, ask AI to give you any answer. AI will give you any answer. AI can tell you things that do not exist. And AI can generate references that do not exist for you. Which means that AI can never ever be a replacement of human beings. But what we are sure that AI can do is one that it facilitates predictions. And we all know that in healthcare, in maternal healthcare delivery system, everything we do is based on the predictive models. Once a woman has PPH, we have a prediction that when we give A, B, C, D interventions, it will reduce the burden of the PPH. That's a prediction. The prediction can be right or can be wrong. If predictions were all right all the time, no mother should die. Okay? But we can build that predictive system robustly if we are able to incorporate AI. And I'm going to share a very good example. Now, what factors contribute to PPH? Several of them. The age, the parity, and so on and so forth. Now, when nurses, midwives, obstetricians, gynecologists are making decisions about some of these risk factors, the question is, how much weight do they add to parity? How much weight do they give to the age of the mother? How much weight do they give to other indicators? Sometimes human algorithms can be limited in that regard. However, we can train a digital system with AI that apportions weight appropriately to the various indicators of PPH, such that if parity is key and parity is entered into the record system, it triggers an alarm which alerts the healthcare provider that no, this person compared to this person is at risk of PPH, and therefore pay much more attention to this person than this person. So AI can enable us to do a lot of predictions about things that will happen and to support us to take initial interventions. Triaging is key. Again, AI can be helpful for women who miss their visits quite often. Sometimes the system is so, we have overwhelming number of mothers to attend to. And sometimes if you're not careful, we lose track of who is coming, who is not coming. But if we are able to digitize our records and we schedule properly, and a woman continuously misses her visit 2 times or so, the system can prompt you, and then you can follow up. If whether she traveled, she's no longer in the area, or something happened. But if you don't have these systems to alert us, the volume of cases we are dealing with will make it so difficult for us to do. So AI can be supportive in everything that we do in the healthcare system. Next one, please. So in summary, AI can facilitate detection of complications, ensure higher quality healthcare, reduce delays, improve referrals and emergency systems, but more crucially, to empower midwives, not to replace them, but to empower them to continue to provide the services that they are good at. Next one. So the benefits are what I have explained previously, and for the sake of time, I'll just move on. Next one, please. Next one. And here is where the issue is, and I'm happy that the earlier presenters mentioned some of these things. One is the cost involved in the technology. So when the president of the GRMA mentioned that there should be innovation fund, he's addressing the cost involved not only in designing the technology, but also in implementing the technology. And that comes with the training. We need to be digitally literate. And I can tell you that there are midwives and nurses who today locate where is A and where is B on the keyboard. So for such persons to be fluent in using the systems, you need a lot of training. Now we can close our eyes and forget about the old generation and say that starting 2026, it will be suicidal for every nurse or midwife to graduate without some literacy in technology. That's how we can build the next generation. So for those of us who are BBC, it's okay. Don't worry about that. Focus on the new one and then build your capacity in there. Then, of course, connectivity issues, which you all know is not a new thing to us. Then data privacy and ethical concerns. We don't go in issue with our limbs and games and all kind of things. These are the concerns that we are talking about. But these challenges are challenges that we can overcome as a nation, and I'm sure this is where some of these are starting. Next. I'm concluding with these recommendations that for us to catch up, to strengthen our healthcare system by leveraging the powers of technology and AI, we just need these 4 areas. The first one is for us to consider investing in the system. An investment comes in different forms, from human resource, the technology itself, to the healthcare system needs an investment. When that happens, we are able to build people, build the systems, strengthen the systems, and then encourage innovation. Ladies and gentlemen, the encourage part, the focus on local innovation is why we are guided. It's like just putting my mind. That's why I wouldn't say much about all these things. But for long-term sustainability and long-term system change, we need policies and programs that can strengthen the gains we are making. If a midwife comes out with an innovation, what is the roadmap? Where is it ending? Where is it going? Who is using it? We need that clarity. And I'm happy that big men and the women at the ministry are here. Until then, innovation will come. It will become like publications that are just published and they die. We don't want to do that. There are lots of ideas people have. But the question is where it goes after it has been developed. That's where the issues. So policy systems, guidelines and programs to strengthen our innovations is key. We always mention evidence-based practice. Evidence-based, evidence-based. The system itself is not designed to support that evidence-based practice. What structures are available at the facilities for nurses and midwives to come together to use evidence to support the decisions they are making? What protocols exist? What protections exist and available for them? So these are crucial issues that can be addressed with policies. And we are hopeful that by the time we invest, we build, we encourage, and we strengthen, we would be able to deploy technology to sustain our healthcare delivery, and more crucially, to expand access to remote areas for those who need it. On this note, I say thank you very much for your attention and for your time. Thank you.
Let's do it better for Prof. Today is all about digitalization, innovation, technology, AI, and in no time, there will be some presentations for us to understand exactly why we are here today. Before we proceed, ladies and gentlemen, allow me to take some few minutes to introduce some key personalities once again. We have here Mr. Kwame Amponsah-Safo. He is the head of CIPMU of the Infrastructure Directorate here at the Ministry of Health. And then we also have here Mr. Insia. He is the Deputy Financial Controller of the Ministry of Health. We also have here Mr. Emmanuel Ofori. He is the Director of Innovations at the Ministry of Communication, Digitalization, Technology and Innovation. Thank you so much for coming, sir. So early on, I made mention that over 100 applicants applied for this. They went through processes, and today we have cut down to the number 12. And so to give us a briefing and also on the grand challenge of today's hackathon is Madam Estelle Ruth Opoku, Head of Midwifery Unit, TCD, Ministry of Health.
Hello, good morning. Oh, good morning, everyone. So we are so excited to see all of you here today. Today, we celebrate Midwives with COMFA. So on behalf of the Ministry of Health, our partners, our agencies, collaborators, we welcome you all once again to the maiden edition of the Midwives Innovation Hackathon 2025. So today, as Mabel said, we are here to celebrate creativity. We are here to celebrate collaboration. And we are here to celebrate the power of midwife-led innovation. And this midwife-led innovation is going to transform maternal, newborn, sexual, reproductive health in the country. So this is our theme for this year, Innovation Hackathon, and it says advancing high impact maternal newborn child health solutions to reduce maternal and newborn mortality through digitalization, technology, and AI. So a lot has been said about technology, AI, and then we are so excited. So before I move on, before we started the opening ceremony, I was called out by the security. And he asked me, somebody said, the security wants to speak to you, the organizers of the program. So I stepped out. And he was, please, somebody has come outside. And the person said, there are some midwives who are developing software, they are developing some things here. And I told the person, no, it is not the ministry, he should go to the rich hospital. Because midwives to him do not have any knowledge about those kind of things. So I asked him, please, did you send an invitation letter to the person? He said no. And I said, so why did you tell the person it is not happening here? Oh, Madam Midwife, they said they almost jaw. So why will anybody think that they are here developing softwares and apps and all that? So as we speak, I've asked him to go and look for the person and bring him or her back to the place. Okay, so that was on a lighter note. So I'm here to share with you a few things about how this whole journey started, how we've come, and then if time permits me, I would like to use the opportunity to introduce our top 12 finalists out of over 100 applications to all of us. So this is the presentation outline, a little bit of background context, Ghana's Maternal Health Challenge, alignment with the Nursing and Midwifery Strategic Plan 2024-2028. What is Hackathon? A lot of people were asking questions when the flyers were moving around. Now, Hackathon also, so we just look at what Hackathon means, and then objectives, purpose, application, and selection journey, finalists, and then today's event, what it's all about. So, pardon my manners, I am still standing on the existing protocol and acknowledge the presence of the chairman himself, my director, Director Technical Coordination, Dr. Hafiz Hadams, and then also all the directors in the Ministry of Health. Thank you so much. So to look at the background, I think a lot has been said from the GRMA, Ghana Registered Midwife Association President. Sometimes people don't get to know the difference between GRMA and GNA. So she is the Registered Midwife Association in Ghana. She said a lot of things about the challenges we are facing in the country, the statistics, and a whole lot. And a lot has been said about that. But we all would still know that maternal newborn mortality is actually going higher and higher than the way we expected. And this hackathon has come at the right time. And it's still a it's still a public health concern that we should all pay attention to. So a lot of progress have been seen over the past decade, and reductions have not been too fast enough to meet the national and global targets. So we need to do something to be able to move forward. So there are a lot of issues that has been happening when it comes to the causes of maternal mortalities in the country, in the district. But I have highlighted few ones so that we all will look at it. The first one, look at the uneven access to skilled delivery services, especially in the rural and hard-to-reach areas. The second one had to do with inadequate referral systems in the country, and then delays in accessing emergency obstetric care. The third one has to do with the gaps that we identify or we find in the quality of care, and then limited availability of essential commodities, which everybody knows about it. When you go to the rural areas, sometimes the equipment, the commodities, the things that the midwife will need to be able to help her deliver the care that she's supposed to deliver is quite not available. And when it comes to the fourth one, persistent socioeconomic barriers that affect timely health-seeking behavior is also a factor. In general, these are the main causes of maternal mortalities, as we are all aware. And the first one has to do with bleeding. We are all aware that postpartum hemorrhage is one of the leading causes of maternal mortalities, and we are all aware that it is also called bleeding. So this is for those who are not non-clinical people. And then usually it's often linked to delayed referrals, inadequate blood supply, gaps in the active management of third stage of labor. So third stage of labor is when the woman has delivered, the baby has come out, the placenta is supposed to come. It comes out, but sometimes a lot of issues happens, and then if the placenta does not come out and something happens, or the midwife is not skilled enough to be able to manage this stage, it causes a lot of bleeding, and this is where most of the death comes from. The second one has to do with hypertensive disorders of pregnancy. We call it preeclampsia and eclampsia. Again, I'll explain and break it down. It's about seizures, fitting, pregnant women going through that mode. And then this is some of the things that also causes that. And then these challenges actually include late detection, because some people go to the hospital late, they don't even go at all. And then we don't pick up all these signals early, and then they lead them into these issues I mentioned. Insufficient monitoring. If you have enough midwives in the facility, you have only one midwife in the rural area or that particular hospital, it is going to lead the woman into these kind of things. And then when it comes to limited access to magnesium sulfate in some facilities, sorry that I'm boring you with all our jargons, but it's important that we give this context. So this is the drug that we use to manage these kind of conditions, and then it has some protocols. If the midwife is not skilled enough, competent enough to be able to know these protocols, she'll not be able to manage the client, and then the client will eventually die. Let me put it that way. So the third cause is the sepsis, maternal infection. If you go through labor for a very long time, if you go through unsafe abortion, if you encounter any poor infection prevention procedures or control practices, it can also lead to sepsis. And the last one that I can talk about is unsafe abortion complications. So the abortion, you can go through it, but if you don't get the right person to do it for you, you have legal abortion, you don't get the right person to go and do it for you, you are going to encounter some of these complications. So the Ghana maternal health challenge has been an issue, as I said earlier. Dr. Nafambo mentioned the figures. We got to know some of the figures last week, and then we were so surprised that this year the numbers are even going higher. It's even worse than it used to be. And with this, these are institutional reports. So between 2023 to 2024, they were having 100 to 110 per 100,000 live births. National estimates remain above the SDG target. So the SDG expects us that we should have 70 per 100,000 live births. But as of November, as she said, we are recording around 900. So approximately 83% of all these maternal and newborn deaths can be prevented. That is why a midwife is supposed to be strengthened. She's supposed to get the competences, the skilled competences that she needs to be able to provide all these preventable deaths. And I'm so happy that if you are skilled enough and able to provide all these interventions for the women, they are not going to die because they are avoidable deaths. So in this era, things are changing, things are moving around. We are not in the era where the midwife has to stay in the labor ward alone. She is not exposed to things when it comes to technology, innovation. Now we have midwives who are critical thinkers, midwives into monitoring and evaluation, midwives into a lot of areas with the knowledge and the background they have in maternal newborn health. They are able to excel in different areas. So innovation is needed actually in this era to close that gap between policy, frontline practice, and also patient outcomes. So the Nursing and Midwifery Directorate of the Ministry of Health under the Technical Coordination, we developed a strategic plan, Nursing and Midwifery Strategic Plan. We started from 2024 to 2028. All thanks to UNFPA again, because they have been a support to the Ministry of Health when it comes to nursing and midwifery. And then we developed this plan. Oh, please, you can clap. Thank you so much, UNFPA. We appreciate it. And the strategic plan highlights key priority areas, and I would just like to just share a few with you. It talks about re-improving the quality of care, the patient safety, to promote innovation, research, and technology in midwifery practice. They're also supposed to strengthen professional development and leadership. They're supposed to build collaborative, multi-sectoral approaches, support digital transformation for health systems efficiency. So that is why we are all here today, because we are working in alignment with the SP, that is the strategic plan of nursing and midwifery. So let's come to the question most of us are asking. What is Hackathon? What is Hackathon? So as you can all see, Hackathon is a structured, time-bound event where innovators work intensively to propose creative solutions to critical challenges. So in our case, we have realized that maternal and newborn mortalities are going higher and higher. So who are the people who are supposed to come together to solve this issue? It is the workforce who are leading that, because it is confirmed that midwives are, if you train a midwife to become very skillful, she's able to avert over 85% of maternal mortality issues and newborn issues as well. So Hackathon is a platform where you come, you propose the issues, and you think critically to address the challenges. Most of the time, it's a brainstorming event where people are not aware of the problem. So they come together and then they think and then they solve the issue at hand. But our issue in Ghana, when it comes to maternal mortality, is glaring. It is all over the place. So our people, they have their own pre-existing solutions that they think when it comes out is going to help them solve the issue. So in our context, our team here, they have arrived with their own existing concepts ready for refinement and also scale up. So when you look at around the world, now it is everywhere because of the innovation era that we find ourselves in. So Hackathon is a global innovation model now. It is used by institutions like Google, MIT, World Bank, UNICEF, and many more. And then what it does is it's to rapidly generate innovative user-centered solutions by bringing together diverse professionals. So our people here coming from all different areas in our setting, they come together, work together with software developers, designers, and others to solve the issue. Now, in our health sector, people have used Hackathon to create these kind of tools and systems. And the first one is mobile birth tracking systems. Is being used in other parts of the country, other parts of the world. AI triage tools, community health surveillance platforms, low-cost maternal technologies, and many more. And these things that I have mentioned that people are already using in their countries has brought about global successes that show the power of structured innovation in solving real-world problems. So why this hackathon? Why did we decide to bring this hackathon? Because, one, it provides a platform for midwife-led innovation aligned with the national strategic priorities, engages multi-sectoral in solutions, where you have people bringing out solutions not to support only one area, especially health, but they're able to align with other areas in the sector or multi-sectorial sector. That's why we have a theme there. So the solutions should be able to solve issues in education, link it to other areas like social protection, other areas like gender, environment as well. So this was also to translate frontline challenges into scalable, context-appropriate innovation. So these are the key objectives of the event. One is to showcase and refine high-impact innovations addressing MNCA challenges, strengthen multi-sectorial collaboration beyond clinical care, select the top 12 innovations for exhibition and further development, advanced solution with clear implementation pathways, and then potential for cross-sector impact. So that's what we were thinking when we started with our journey. So we decided that since we want to do a national hackathon, a national planning committee is supposed to be constituted. So we came out with a team to ensure that, one, the hackathon will be relevant to the Ghana's MCH priorities, aligned with the nursing and midwifery strategic plan, as I've already said, should be credible, fair, and technically sound, and then many others, as you can see there. So the planning committee were selected carefully, and then we have people who were from the academia when it comes to midwifery, the people from clinical side, people from practice, and then also some colleagues from the nursing side as well. And then we also brought on board people from the IT world, people from the AI world. We have people in Ghana now who are actually specialized in AI only. And then people from the innovation agencies, people from software developing companies and research, and also we from the Ministry of Health at the policy level. So we came together to constitute this team to spearhead the whole process. And then we actually came together so that we'll be able to find the issues, set the problems right, develop challenging themes, and then make sure that we create eligible criteria and processes for the program. And then we also had evaluation rubrics to also evaluate the applications that came in. And then we also facilitated the shortlisting and interviewing processes. So over 100 applications, as Mabel said, came out. We opened the application somewhere, I think July, August, and then we had over 100 applications. After the rigorous evaluation and review, we realized that some had applied more than once, so they were taken out, and then we had this 80 applications for midwives. We included people from the schools as well. If you're a student midwife and you have an innovation to reduce the problem, you can also apply. So with this, we went through the processes, screening, selecting, and then we shortlisted over 54 people because they all had great innovative ideas. And then we evaluated them using a standardized maternal, newborn, child health innovation rubric. And we came out with, we worked with people who come from where I have mentioned, but we did not draw them from the National Planning Committee. We actually brought them outside to actually take the applications through the screening and selection process. So with this, we also came down to reduce it from 54 to 27 applications because there were still more strong applications that had great innovation. So we decided to still screen and then get the 27. The expert also reviewed them according to the rubric I shared under feasibility, under innovation, under depth, the clarity, and the readiness for scale-up. So this is a sample of the framework that we use, I've shared here. So with innovation and originality, we said we give a mark of 25%. When it comes to the impact, is it very impactful? Is it going to solve the issue of maternal and newborn as we have stated? Is the plan scalable? Because some people can think about some idea one day and just get up and think that it's going to solve the issue, but will not be able to scale up from even where they are to the next level. So we wanted to find out if it's even scalable at your level, a district level, or even your CHIPS compound. And then is it sustainable? Because ideas can come up, but some ideas are not actually going to stay for long. So we wanted to find out if it's going to be sustainable without funds, without other factors. And then the other one looked at technical feasibility. The other one looked at presentation, how you are able to articulate your ideas clearly for us to know that you know what you are about. If you are not looking on any computer, we need to be able to tell us the features of your app, the technical things about the app, how you have, are you going to implement the plan? Should you receive the award? And then all that were part of the things we looked at. So we went through the rigorous process, and then our aim was still to find the 12 outstanding innovations. Then we came finally to get our top 12. And then the 12 finalists, we had to interview them when we got the 27. And then we had to set 2 separate panels who ran concurrently at the same time because the voluminous nature of the work was too high, because we wanted to look at it critically and select the best 12. And with this, we had people who have plans of sharing with us digital maternal newborn platforms, AI telehealth, postnatal mental health support systems, community-centered pregnancy monitoring solution apps, cross-sector data, and safety innovations. These represent the future of midwifery-led innovation, and these all came from Midwives. So today's event is all about celebrating, showcasing, pitching, showing our great ideas out for everybody to know what midwives are also about, apart from what people usually think. Now, I said those who think that we stay in the labor world again, alone, are in the 80s or in the 70s, if that's what you still think. So now we've moved past and we are ahead and we are going, and the sky is our limit. So we are here to showcase these things to you. Some have products, some have real-time products that they are going to show to us to solve the issues. Some have concepts. Some have also developed a software app. Some also have demo to show you. Some also have prototypes of what they want to do. So the focus is what I have mentioned earlier, and then we'll give them opportunity to scale this innovation up. We will mentor them, collaborate with them, and then we'll partner with them. So the awards. The winner today, I think they've not seen this for the they are seeing it for the very first time. The winner is going home with 50,000 Ghana cedi. Yes. Together with your plug, the first runner-up is going home with 20,000 Ghana cedi. And the second runner-up is also going home with 10,000 Ghana cedi. So there are a lot more, but currently we have some partners who are also interested. We are in touch with Google, Microsoft. They are all interested, so we'll talk about that later. But currently, Google has confirmed that the top 3 will join the UNFPA Innovation Fair Google, and then they are going to be supported with $10,000 if you win that stage. And you're going to be given mentorship, as I said earlier, development pathways, how to scale up, and then the sky is the limit. You can go as high as you want. So we acknowledge the support of our directors in the ministry. We couldn't have done anything without them. Thank you so much, Director TCD, Chief Director, Honorable Minister first, before I lose my job. Honorable Minister first, the Chief Director, and my Director, Technical Coordination Director. Any letter I send, he quickly approves it and it goes out. Thank you so much, sir. And all the directors, Dr. Irene Bono, thank you so much. You know I always appreciate you wherever I go. God bless you all. UNFPA, as I said earlier, they have been the backbone of midwifery when it comes to this country. They've done a lot, supported us a lot. Currently, a lot are going on to develop midwifery education and practice centers of excellence across the country. So we can never do without them. God bless them. And Nestle Ghana has come on board to support us. So these awards that we mentioned are coming from Nestle. So KNUST, thank you so much for the support. Professor Jomoku is here, Prof. KNUST, thank you so much. Dean of School of Nursing and Midwifery. The judge, then the committee members, the partners, all innovators. The hard work that you put in, the sleepless nights, the time that you have to go so hungry that you want to cry, staying on a midnight call till 11 p.m. every day. God bless you all. And these are our collaborators. We appreciate you. GCNM, our beautiful Dr. Achampim is here, Ghana Health Service, NMC, HTI, UGMC, IMA Trust, GRNMA, and JRNMA. Thank you so much.
That was very comprehensive. Estelle and your team, you have done marvelously well by giving us detailed information as far as this hackathon is concerned. Another round of applause for the team. You've done so well. I believe by now we have all the explanation that we need. Right. Dr. Chair, distinguished ladies and gentlemen, at this point, as we are about to witness innovation creativity and problem solving at its best. It is an honor and a privilege for me to introduce to you our jury for this event. Indeed, they are accomplished professionals with rich expertise as far as the subject is concerned. They've been carefully selected to assess the candidates' ideas with fairness, insight, and professional rigor. A round of applause for them. I heard Estelle saying they will be introducing themselves, and so I don't think I will want to do that. I understand they have a chair, and so at this point, I would want to use rights. I'll hand over the microphone to them so they can introduce themselves.
Thank you, and I think it's still morning, so good morning, distinguished ladies and gentlemen. I stand on the existing protocol and to say on behalf of my fellow jury that we are delighted and privileged to be part of this exercise. I think that we are gradually coming to the climax of everything, the reason why we are here today. I also want to tell the innovators that taking a deep breath, relax, and when you are called, come and do what you can do best. Before I give the mic, I think that you have our profile, so what we would do is basically maybe to mention our names so that you get to know us. But before I do that, I just want to let the innovators know what will be happening once we finish the introduction. Each innovator would have 15 minutes to present your idea or your innovation, and then you have 5 minutes of interaction or question time. When the 15 minutes is up and you are still speaking, forgive us, but we would have to stop you right there. So try and stay within the 15 minutes. We would start with the first 5, and then we'll take a short break and come back and conclude with the remaining. And I think that is okay. My name is Dr. Evelina Samuampofo. I'm a senior lecturer at the School of Nursing and Midwifery, University of Ghana, and I'm delighted to be here. I would ask my colleagues.
Good morning, everyone. I'm also excited to be here. I think Doctor has laid the foundation for us, so there's no need to go into details. My name is Hamza Mumuni. I work with Stanbic Bank. I manage our business incubator, and so we are a center of innovation. We promote enterprise development and wonderful programs like this. And beyond this program, we're also interested in mentoring people who want to take it to the next level. So it's good to be here. Thank you very much.
Hello everyone, my name is Peggy Yeboah and I'm the Innovation Specialist for UNSC Ghana. I'm excited to be here.
Thank you very much. So my name is Hammond Sakwa with the Ghana Health Service, Deputy Director IT, and excited to be part of this program. Thank you.
Hello everyone, it's a privilege to be here. My name is Constance Odonko, a practicing midwife at the Kolebo Teaching Hospital. Thank you.
So before we continue, I would want to introduce here in our midst Madam Agnes Opomba, Director of Examinations, Nursing and Midwifery Council, representing the Registrar.
So I think that we are all set, and I suppose that we would go according to the list that we have here. So we have the first person as Nankwati Rose. Rose, yes. So you are the first person to present or to pitch, and
All right. Rose, I realized, I saw from your face that you were surprised. I have a score sheet here, you are number one, but we'll go with this one. Okay. You've been saved by the bell. So, Ramat, Abina, and Nima. Ramat. I think we should encourage her some more.
Dr. Chair. Dr. Chair, Directors of the Ministry of Health, representative of other sector ministries, Directors of Nursing and Midwifery, Chief Nursing and Midwifery Officers, United Nations Deputy Country Representative, our esteemed jury, Principals of Nursing and Midwifery, fellow midwife innovators, our distinguished guests, ladies and gentlemen, I welcome you all to this important mission. I am very grateful to be given this opportunity. My name is Abane Ramat Aniama. I am a level 300 midwifery student from the University of Ghana School of Nursing and Midwifery. I am from the Upper East region. Ghana has continuously experienced high maternal and newborn mortality. The reason for this increment is not because solutions do not exist in the country, but because these solutions arrive late. Mothers have continuously experienced delays, which has increased the rate of maternal and newborn mortality in the country. Mothers experience delay in the decision to seek care. This delay is caused by inadequate knowledge on these danger signs. Others to it as a result of the support they need to get to the health facility. The second delay is the delay in identifying and reaching the health care facility. The third delay is the delay in receiving appropriate treatment in the hospital. During my domiciliary practice at the village, I experienced how mothers face devastation complications as a result of the delay they experience in accessing health care that they need. As a result, my innovation is to bridge the gap mothers face in these three delays: the delay in identifying these danger signs, the delay in getting to the health facility, and the delay in accessing the quality health care they need quickly. These are the core features of my innovation. My innovation is about the digital health platform application that can easily connect mothers to midwives at the comfort of their homes. So with my innovation, mothers can use the messaging to contact to contact midwives in order for them to assist them with the needed healthcare services they need just at the comfort of their homes. These are the core features of my innovation. The display of danger signs. With the use of my innovation, danger signs would be captured on this platform to enable mothers know what these danger signs are. This feature is to help create more awareness and educate mothers to empower them, enable them seek health care when the need arises. Another important component of my innovation is the transport model. When mothers come for antenatal, we encourage them to prepare towards their delivery by telling them to make arrangements with somebody to help transport them to the hospital in case they experience any complication. But with this feature, midwives are actually going to actively take part in arranging transports for these mothers. When they come for antenatal, at least information about 3 people, either their spouse or taxi drivers in their homes or their neighbor, anybody who has the means to transport them when the need arrives. We take 3 informations on these people, and monthly we'll send reminders. Those who can't read, we'll call them to inform them that they've registered as a transport support for this woman. So when the need be, we'll call them. These reminders are sent to keep them informed. So when the day comes that we need them, these people are already informed and they'll quickly assist to reduce the complication that could set in. Teleconsultation is also a key feature of this innovation. With the use of messaging and voice call with audio recording, mothers can register on this platform, which will give them access to midwives. And once they are able to contact their midwives, they can describe their problem to them for them to attend to them. If there is a need for the woman to go to the hospital, arrangements would be already made for them to come. It's not now that the mother will get to the hospital and arrangements have to be made for her to attend. Symptoms checker is also another feature of my innovation. Symptoms will be listed on the app, and there was also an option for mothers to record an audio message describing how they feel, and it will come with prompts. If there is something that you need to do whilst you await to get a response from your midwife, there is a guideline for you to follow. And if there is a need for you to be at the hospital that very moment, your midwife will be alerted right away so that she can attend to you. Voice and SMS reminders is also available to remind mothers of their antenatal schedules and immunization schedules of their baby. Toll-free access is available for mothers who are unable to read, therefore they are unable to register on this platform. There will be a number with pre-recorded audios in various languages that are in the country. So women that are not able to read can easily dial this number and follow instructions to select their preferred language to enable them get the care that they need from the healthcare professionals. What makes this innovation exceptional? The first point is that it addresses all the 3 delays, which is the delay in decision making to seek care, the delay in getting to the health facility, and the delay in accessing the care they need. This model also covers the full spectrum of care. It is comprehensive. No woman is left out. Puerperal mothers are included, pregnant women are included, children are included, adolescents are also included because their body is not well developed to accommodate pregnancy. So they tend to be at risk of complications when they get pregnant. This model also supports low literacy users. That is why the toll-free access is made available so they can just call and then get the help that they need. It also includes teleconsultation, direct teleconsultation with midwife. At the comfort of your home, just with a single click, you can easily get the care that you need. You don't have to walk to the hospital all the time, provided it is not something dangerous. And it also has the unique transport model, as I explained earlier. The growth and continuity plan of this innovation. The scalability plan is that this innovation is very simple. It uses a simple mobile device which has simple features such as the SMS, the call, so it can be extended to other communities. Once with the initial trial, few communities can be selected, midwives trained, mothers trained on how this innovation can be used, and at the end of the training session, focus group meetings can be organized to take information from the users onto how this app has helped them and can be used to match the health outcome in relation to the usage of the app. With the sustainability plan, this innovation can be sustained by integrating it into the Ministry of Health budget, collaboration with telecom organizations can be done to provide subsidized data for mothers at a lower cost, and non-organizational NGOs and philanthropists can also play a long way in helping to sustain this innovation. So with my innovation, just with a single click, you can connect mothers to the healthcare they need in order to address all the delays that they face. Please, I would like to walk you through the innovation. The name of this application is Mother Nest. So when you open, this is the interface. You can register as a mother, you can also register as a client, and you can also register as a midwife. So right now I'm registering as a mother. When registering as a mother, you are required to provide your bio data. The first one is your full name, followed by your email. You are required to enter a password. The additional information includes your age, and you select your location. If your location is not listed here, you can tap on the custom to input your location. This is an option for you to enter your significant partner's name. And with this, whilst reminders are sent to you about your antenatal visits and immunization schedules, your partner will also get the same notifications. So when you are not able to detect these danger signs when you see them, your partner may be able to detect them so that he or she can prompt you. You enter your partner's phone number, address, occupation, and you log in. So I have registered for it, and this is my interface. It's not showing. Oh. Oh my goodness. Okay, so I have logged in, and this is the interface of the mother. When you click on labor and pregnancy, the first thing you see here is the danger signs. So these are the pictures of the danger signs. In case the mother cannot read, she can see this picture to at least give her a signal of how it feels to have a severe headache. And these are the prompts on what she should do while she awaits for a midwife. The first thing is for her to call her midwife while she waits for her response. These are the things she can do while she waits to get the health care she needs. These are more danger signs that women experience in pregnancy. And this is the symptoms checkup. So this is the audio recording button. If you want, you can just tap on it to record the symptoms you are feeling. Otherwise, you can select what you experience at the moment and tap on check symptoms. So if it is a very serious condition you are facing at the moment, your midwife will be automatically alerted so that she can attend to you. And chat with your midwife. For this one, the woman can request for teleconsultation with their midwives so that they can get the health care they need. So, hello, Awodede, how may I help you? That is the message you've gotten from your midwife, and you can continue to have a conversation with her. You can also have a video call with her for her to see how you are feeling, if that is what she needs to assess you with. This is the transport support model. So these are the details of the transport support of the mother. With this, that is how we get to send reminders and calls through. These are the details of the transport support model. So with this, midwives can send SMS reminders to these transport support people, and they can also call them to alert them. And it comes with a feature with the hospital listed and a map to directions as to where these hospitals are. So in a case where the woman finds herself in a new area and she doesn't know where these hospitals are located, she can use the map, which will give her directions to where the hospitals are located so that she can get the care she needs immediately. So this is the option for the mother to select the languages that she is comfortable with. She can use this option to enable her communicate effectively in expressing the symptoms she experienced to the midwife. I would like to log in as a mother and I would like to log out as a mother and log in as a midwife to demonstrate the interface of the midwife. So as a midwife, you input your bio data, your email, your password. You have to enter your staff ID, your facility code, and your NMC PIN so that random people can't just sign up onto the app to impersonate midwives. So with this, meaning the app is supposed to be connected with the database of the Nursing and Midwifery Council. So all nurses or midwives that have been registered, or midwives, sorry, that have been registered on the app can be verified. You enter the facility code and your NMC PIN. Then you register. So whilst you Yes. Yes. Okay, so when you register, you get this prompt that your account has been verified. That is when the database has been connected to it. So this is the interface of the midwife. When a client sends you a message, you get a prompt here so that you receive it to connect with her.
No, we have. Timekeeper. Her time is up. My dear innovator, relax, okay?
Yeah.
We gave you additional few minutes for the challenges we had, but that time is also up. But what we want you to know is that you have taken us through the most important aspect of it to help us, make a decision, and also based on the questions we'll ask you and the answers that you would give would help us. So don't worry. Unfortunately, I would have to let you stop here so that we can ask you questions. Okay. Let's put our hands together for her.
So before, well, even though I'm the chair, but you now have the floor as jury. And with your permission, I just want to make some few comments because of what we are experiencing. Now, what will happen is that subsequent presenters, if you have similar nature of rundown, what you have to do is to tell us generally what it consists of. Because the details of it is supposed to be assessed by the jury. And they have already done that, so they know, and they are going to award. And they haven't done that. This is the first time. Oh, I see. Then we're in trouble. Then we're in trouble. I thought they had already gone through the details, and because it's bound to okay. What is happening is that they are using their own network. And as said by Prof and one other person, is showing practically now connectivity has always been a problem. And I don't know how we are going to handle it. That's why I was going to propose that if you had already seen and heard about it, it would have been just easier for them to run us through. This is the nature, and this is how it works, and would have been okay. But once you have to depend on that, it means that we have to do something about it. So, okay, well, I've been told that our IT people are working on it to establish maybe a better connectivity line for us to see. So just hope that those who are next to present, just make sure that you put your program in order to be able to present it within the time, because you are allotted time and you must work within the time. Thank you very much.
Thank you, Mr. Chair. Innovator, like I said, I know by now your heart is beating and you are discouraged. But like I assured you, we've picked enough significant things for us to score you. Okay, and we also acknowledge that challenges that you faced. So now, taking a deep breath and answer the questions that will be posed to you. I would hand over the mic to my
Okay. So just relax. I think we've seen enough. You've shown enough. These things are bound to happen, so we understand. My area of concern, or the area I want to focus on, is the originality of your solution. In your research, have you run into any existing solution that has come very close to what you are presenting to us? And what value are you adding to that? So that I'm clear on my mind that you are hitting it from a very fresh point of view.
Okay, thank you for the question. I already know there are systems in our health facilities that make use of digital tools. However, it doesn't address the delay mothers face in recognizing these danger signs and the delay they face in getting the transport support they need, and that's of the getting access to the health care they need. So this model seeks to address these gaps in the sense that once complications are not treated urgently, we can lose the mother, and that is one of the things that accounts for the increase in maternal and newborn mortality in the country. So my innovation bridges the gap between the delays mothers face. So I think it is a fresh idea that can help reduce neonatal and newborn mortality in the country. Thank you.
Yes. Well done, Ramak. I think my question is more around the feasibility of the project. I know you gave an overview of your sustainability plan and then your implementation plan too as well. But can you please give me some clear next steps from here? How do you intend to proceed with it? Have you piloted it? How many people have you piloted? In which communities? And then I think my last question would be, what are, apart from the logistical barriers, what are some of the issues you are facing towards to refine your tool, your app?
Is the first question
The
again?
first one was the next steps, your
Okay.
timelines here.
Okay, so I have not piloted this innovation in any community. However, when this innovation is taken into consideration, I seek to partner with district health partnership with district health communities, and then seek for help to train more midwives and mothers into testing this platform. And after the testing phase, an evaluation will be conducted to see how best the mothers who made use of this application, how best has it been able to bridge the gap in the delay they face, and the best health outcome they've received with the usage of this app. That is what I intend to do.
And then the next one.
Please, can you repeat it?
The barriers you are facing, apart from the logistical barrier, what are the barriers that you think you need to refine your software?
Okay, so with the technological barriers, as I showed earlier, there is an option where mothers can communicate. That is the use of the messaging and the voice notes, and that of the languages. Even though it is on the platform right now, it can't be used because this is a prototype. The one I contacted to help me develop this application made mention that it is more like a project for a whole departmental IT company. So because of the limited short time frame and financial barriers, this has not been able to be implemented because so far this is just a prototype. When support is given, I wish to bring this into a reality where mothers can utilize this innovation to help reduce the rate of maternal and newborn in the country, to build a stronger Ghana for both mothers and newborn and the general population as well. Thank you.
Thank you very much for your creative and innovative presentation. My interest is more on scalability, sustainability, and also interoperability. So when we talk about this service, I think that service is supposed to be continuous. So I'm looking at how will this application feed into the picture of the entire service, so that somebody receiving care on your application data will be found in the games, will be in the dens, will contribute to the national picture, so that we wouldn't come to you to seek data to take decision, but your system has fed into the mother system for us to have access to the data for quality decision making. Is the question okay?
Yes.
Thank you.
So when this innovation is selected, I don't seek to own this as a single individual, but I look for partnership with the Ministry of Health and other organizations that can help improve this app to help reduce the challenges that our mothers and newborns face. So this isn't something that is going to be handled by me, or it is going to be in my possession for personal use or for business sake to generate income. No, the purpose of this innovation is to help create a better Ghana for all mothers and to help reduce the mortality rate in the country. So this is a project for the country. It is not.
The question is, how will you do that?
So this app, I intend to have it on Play Store for it to be installed. So once you have access to it and you install it, and it's using simple technological features. At least every household in the country has a mobile phone. You can install it. If you don't have a mobile phone, you can make use of the toll-free number. So once it's available on Play Store, everybody can get access to it. Thank you.
Okay. Thank you for your presentation. And I want to look at the impact, that is the potential impact with your innovation. And I want to say that with regards to this innovation, if this is implemented, what will be your immediate steps that you take regarding this innovation?
The immediate step I will take is to first analyze the data we already have in the country to identify communities that have recorded high neonatal and maternal mortality. So that is where I would like to start the initial testing phase of this application. So we will select those communities, create more public awareness on the usage of this application, and run this innovation in those communities for about a year to see how best this innovation has been able to reduce the rate of maternal and newborn mortality in that community. Thank you.
Thank you, Ramat, and well done for coming to present. We would discharge you honorably.
Thank
Let's
you.
give her a hand.
So, you realize the contestants have been asked to move out. Yes, the jury asked them to, because they don't want them to listen to the answers that their other competitors are answering. Yes, so that's the reason.
Yes, thank you very much. I'm making use of my position as the chair. I know I'm not part of the jury, so jury, you don't take account what my questions will be. It's just an advice for her to consider, because I'm looking at the type of phone and messaging application that will be used by mothers. Because if my mother has no classmates, certainly she will not be able to have an email address and all those things. And remember that we want it to be used, you know, everywhere, because the mother side is where I'm emphasizing on, because we will have a lot more illiteracy. Then, where there's no electricity, how will they charge the phones? That's the other thing. We should be thinking through it so that in your name. And then the registration process for illiteracy. I believe if all these things are captured, they will be very useful. And the offline usage, we should be able to make it in such a way that you don't need to be connected by internet. You should be able to use it offline. I don't know whether all this thinking have gone into it. So forgive me if I'm intruding into your assignment. I was just thinking aloud. Thank you.
Thank you. So you are not intruding. I think that we have more questions that we would have asked her. But we are also working within time and looking at the number of innovators we have. So that is why we stopped at that point. But your questions and your comments are very, very important, and we've taken notice of that. Thank you. So I think we can invite the next person, yes, who is Annabella Noel.
Okay. So please, Chair Jury, Madam Chair, please, before the second contestant speaks, allow me to introduce myself. There have been concerns that I have introduced people and I didn't introduce myself. My name is Mabel Ado, and I'm with the PR unit of the Ministry of Health. Thank you.
So Noel, you would also have 15 minutes, like I mentioned earlier, and we would be alerting you as and when your time is getting exhausted. I wish you all the best.
Good afternoon, Dr. Chairperson, and please permit me to stand on existing protocols. Please, my name is Annabella Noel, a staff. Please, my name is Annabella Noel, a staff at Continental Government Hospital, specifically the Mother and Baby Unit in the Ashanti region. Please, about 2 months ago, a 2-year-old baby. Please, my name is Annabella Noel, as earlier stated, and I staff a staff nurse at the MBU, Mother and Baby Unit, at the Continental Government Hospital in Ashanti region. About 2 months ago, a 2-year-old boy died from cerebral malaria due to late detection of fever, which led to, due to a late treatment of this child. His mother actually cried and said, "If only I had known earlier." This moment and many others experienced in my line of work inspired Thermagard Baby, a smart mat that is actually designed to simply continuously monitor the baby temperature whilst the person is asleep or probably awake. And also it has an early detection feature where if there is a fever, the smart mat actually prompts or gives signal to the caregivers instantly. And also it has a cooling component where if there is like a fever, actually it helps to cool the temperature of the baby also too. So we have why is Thermagard Baby actually required or needed? Globally, 7 in every 10 childhood deaths in sub-Saharan Africa countries are associated with fever-related illnesses. That's according to WHO, the World Health Organization, in 2011. In Ghana today, fever-related illnesses cause major under 5 deaths. Malaria kills in every 5 children. That's according to Ghana Health Service annual report in 2023. Mothers rely on touch or guesswork, which is inaccurate or detects fever late, like far too late. Available thermometers only give spot readings, and imported devices are expensive to actually use in our country here because of how expensive they are. Therefore, there is a need for locally made continuous temperature monitoring devices in Ghana. So the solution right now is Thermagard Baby device, a smart temperature sensing infant mat that continuously monitors, early detects, and immediately alerts via an alarm buzzer and sends SMS notification to mothers or caregivers. We have a picture of a baby being laid in our device, which shows a real-time temperature monitoring visual. When the fever, like when there's a fever of whatever, like when there's a fever, the alarm buzzer actually goes to actually wake the mothers or any caregiver who's not around, and also to sense a signal like an SMS notification to any caregiver who might not be around, like the baby. So the cooling component actually comes in when there's a fever triggered, and actually comes in to cool the temperature of the baby. That's like a future integration that you're actually planning to put inside the thermoguard baby. So the temperature reduces, goes back to normal, the mother actually does actually stay back in the house because the temperature is normal, but the person has to go to the hospital again. Other features of the thermoguard baby device also too is the moisture detector, which actually is placed to detect whether the bed is wet or if there's like the diaper of the baby is actually leaking. It also has a safe materials that are actually being used to design the mat to actually reduce any form of allergies. It has a long battery life too, and also two rechargeable ones. Why is thermoguard baby unique? It uses locally and readily available baby safe mat, which is hypoallergic to babies. It's cost effective because what a manual thermometer can do, this mind device cannot. Like what mind device can do, a manual one cannot actually do it. It takes out the manual work in every form, every form. It works offline. That means that the SMS are not supposed to actually have internet connection before you can receive it. It works offline and it has a real-time monitoring device too. It quickly detects abnormal temperatures and sends notification to the caregivers also too, and it creates local job. Please, our target audience for this our device is for urban and peri-urban families, rural and low-resource communities, hospitals and health facilities, daycare and early childhood schools. Cost estimation: we actually plan to make it 350 Ghana cedis with just a profit margin of 50 Ghana cedis because we want to make it really accessible and affordable for the mothers, comparing it to the manual ones. Please allow me to walk you through the demonstration of my device, please. This is a thermoguard baby device. We have the infrared sensor, which is placed slightly above the baby's forehead. It's actually adjustable to continuously monitor the baby's temperature whilst asleep. Alongside the infrared thermometer, we have the rods. Okay, you can see. We have the rods which are placed to detect temperature of the baby at the feet level, because maybe the baby sleeping might tilt the head away from the infrared. In that case, the rods would still pick up the temperature of the baby, irrespective of whether this one is tilted or not. We have the moisture sensor here, which is beneath the baby's buttocks, which will detect whether the bed is wet or not wet. When it comes to the display unit here, we have the display unit which actually displays the visual aspect of whatever that the temperature sensor is actually recording for the mothers to see. It is buzzing because right now the temperature is actually low in the room because they have no babies inside. But if it is actually a normal temperature, it's supposed to be a green. That means that the buzzer will not actually sound for anybody to hear. Okay, sorry. Please, let me display the moisture sensor for you to see. The moisture sensor indicates that it is wet. That's the moisture sensor, because there's no baby inside. It was actually working this morning with the temperature sensors. Yes. Please allow me to actually explain again. Okay. Please, at this moment, as I said, so when the temperature is actually normal, it actually has a green light on to display that it is normal. So when I remove it, as I said, it goes off because like the green light goes off to activate the red light because the temperature actually is low currently. That's how it works. And alarm buzzer sounds for the caregiver to actually hear if if awake, like if sleeping. That's the display unit to actually show the readings of the baby's temperature, which is actually shown here. And we have the SMS alert too that actually sends messages to the caregiver that there's maybe the temperature is cold or maybe there's a fever. That's the SMS alert. Please, these are the the core features of of the SemaGuard baby device, which I actually have explained to you. Please, the impact. Address the leading cause of child. Please, it addresses the leading cause of child emergency admissions and deaths, which is the late detection of fever. If caregivers can detect fever at the onset of infection-related conditions, we can prevent more than half of deaths that are caused by malaria and other infection-related conditions. According to Ghana Health Service annual report, that states 20% of deaths caused by malaria. Reduce unemployment rate in Ghana because this device could actually be locally manufactured because every component pertaining to the development of this device is actually obtained in Ghana here. And therefore, it has greater inclusion for underserved communities in the sense that mothers are going to actually be empowered to actually take charge of their baby's care because everything is actually done by the device. What they need to do is just to actually know that this baby at this very moment has a high fever. That means that he has to seek health care instead of just sitting down and guessing that things are not actually it's normal. Meanwhile, it's not normal. When this also is implemented, I know that mothers would actually have that kind of enthusiasm to actually go to the hospitals earlier than compared to the previous days or the previous moments when they can only just touch it and say, maybe I'm not bothered. Please, I know that SemaGuard baby device is not just an innovation, but it is one that would be a voice to infants that cannot actually speak for themselves. Not just a simple innovation that we are actually seeing here, but one that actually have impact on the lives of babies to save them from actually having this fever-related condition being worsened in our country, Ghana here. Please, thank you.
Thank you, Noel. So we'll have some questions for you. Okay. Well done, Noel. I have a few questions and some suggestions too as well, but I think I'll start with the suggestion because I realized that you had to make a personal contact with the wire, and this could be a feature that would be very uncomfortable for some mothers, right? So instead of having just a net, you could have an incubation, like an incubator, which records the temperature of the baby. That it doesn't have direct contact wires with the baby, so that there could be pillows, mattress, goes in it. So that's something you could also consider.
All right, please thank you. Please thank you for that.
Yeah. And also, I also realized that you had the aspect for the water. Yes, and I think adding too much features also makes it more complex and very expensive. So you could also consider what is very important if it is just the thermometer getting to read the temperature, or it is focused on both. And those dual functionality, what are the cost implications for both aspects? Yes. But my final question is a good prototype, but I also wanted to know what are your next steps? I think for me that's very important. Looking at 2026, what are your timelines? What do you think? How would you want to proceed further with or without the funding?
Okay.
Thank you.
Yeah, please thank you for the questions. With the first question, which talks about the uniqueness of this device, whether it is the moisture sensor or the temperature sensors. Yep, the temperature sensors plus the cooling aspect, as earlier indicated, are the core features. Definitely, the moisture sensor is just like just came into alert caregivers that maybe the diaper of the baby is leaking, or maybe when the mat itself is wet, to just wipe it off. But the unique part of it is the cooling aspect, which is going to be efficient integration, whereby when a fever is detected, it won't only just detect it, but rather activate the cooling system to temporarily give a cooling effect for the babies before the mother actually seeks the health care. So these are the very core features of my ThermaGuard baby device. And the final question, which actually was talking about how I'm going to actually implement, that's the implementation of my innovation. I have 12 months frame for the implementation, where I have the first 0 to 4 months as the piloting, where the prototype as it is going to be developed, piloted. Then from the 5th month to the 6th month will now be for the field testing, that of the feedback. So we test it in our rural communities, and if they for mothers also to actually go to purchase or probably going to be given to for them to use. So they'll give us the feedback how it works and probably what they think it would be feasible for them to work with, as earlier suggested to me also too. They will now put those things into play or probably develop a better one. They will now have to go for the mass production of it, and maybe and definitely since it's a device that is going to actually work on medical condition and other stuff, that means they will have a pre-certification to actually apply for. Yes. Then the final phase will now be the mass production entirely, where we can actually distribute or probably partner with some agencies who I think probably would bring the cost of it also to down for people, for mothers who actually cannot obtain it in the price range that is probably being given. Please, thank you.
Okay. Thank you, Noel, for your presentation. And what I want to say regarding this innovation is that our part of the world, I was listening to you attentively regarding your presentation. And you said, this would let mothers detect if there's high temperature in the baby. And we all know that sometimes high temperature can be as a result of certain. Okay, I was saying that regarding this innovation, our part of the world, when you are given health education regarding what women should do or the mothers should deploy when they go home, sometimes high temperature could be as a result of extra clothing. Okay, baby has been covered with extra core sheets. So now the baby that warmness will be detected. In addition, it could be the room temperature.
Thank you.
So then I want you to show more light. So where do we come in? Where do yours come in? Does the baby need to be in the baby cot or this prototype you made without any clothing? Or yes, I just want to have that because if not, they'll be rushing to us. Yes. But we realize that there's no cause for alarm. Maybe then on the lighter note. So I wanted to throw more light on that. Right. Thank you.
Thank you, please. With the aspect of whether it's a condition or maybe just the room temperature, as earlier stated, we have the moisture sensor. There's a moisture sensor. That means that it actually records anything that is moist. As the room, as you're in this room, if the room is actually moist, then that means that definitely this moisture sensor would actually detect that it is the room is moist. Therefore, the baby needs to be added extra clothing. That's what the moisture sensor actually here is actually meant for. And when the room is actually hot in its sense, this moisture sensor, as I said, is a moisture sensor. It actually detects that it's a dry moment. And besides, we would have to incorporate a feature which would actually read a real-time atmospheric pressures that actually would enhance or probably make the mothers know that the baby's temperature is not actually due to a condition, but rather the atmosphere temperature that's actually affecting it. Okay,
so I would want to add some few suggestions with this innovation. And when you are having your pilot study or you are training the team on this, what I want you to add is the health education regarding this. Because, for instance, they should be aware about that. The extra clothing can lead to the warmness, the room temperature, and all of that. And also, what about the side effects? Because I heard you talking about some rod. How would the rod be displayed, and the baby coda will not affect any injury? Because I didn't hear you talking about that. Was the rod? I don't know. I haven't seen how the rod looks like, because our babies are special to us, so we want to ensure that they are safe.
Please, the rod is just one of the rods that actually placed in the manual, the other type of thermometers, which actually placed under the armpit. So just that one, which actually is a safe for the baby skin. So it don't actually cause any bruises on the baby skin too. And besides, they are not going to actually be placed directly on the skin. It's going to be placed under the feet. That means that the baby can actually still wear socks. While the rod actually are still operating.
Okay.
Yes, please.
So technical information is important, because if not, you won't have it effectiveness.
Yes.
Thank you.
No, thank you very much. Just a quick one. So this one is on.
Ladies and gentlemen, we are supposed to break for snack, but time will not allow us to do that. Snack is being served here in the auditorium, so in an orderly manner, you can just get up, grab something for yourself. You direct them, yes. My lady will direct us as to how to go about it. Thank you.
Thank you. A quick one. So this is Innovel, something new. I'm looking at maintenance. I'm looking at replacement of components. I'm looking at troubleshooting. In case this goes up, people are now purchasing, how do we do maintenance? How do we address repairs? How do we talk about components not functioning? And this one is just a piece of it, but it makes so much of noise. Can we make it a little digital so that it wouldn't wake the baby up, but rather maybe send some information? Thank you.
This regarding the maintenance of my device, this, as I said, is a prototype development. But it has like the materials that are actually going to be used to make this device would permit or would allow one to clean it, like a waterproof layer that's on top, which will allow mothers to actually wipe it or clean the surfaces without actually having to take it out and wash it. And besides, so with regards to the components part of it too, they are already like in the system here. They are already in Ghana here, which doesn't need to be actually imported to actually delay maybe fixing or something like that. And besides, so they are all like basic components that actually used to develop these ones. That means that any IT, like any biomedical engineer in our hospitals or in our system here, could actually work on this device without needing any special training with regards to the maintenance of this baby guard device.
Okay, thank you very much. That's a good one. And again, we're going to circle back to our chairman's consent. There are a lot of dependents here. You will need to charge it, right?
Yes, please.
So we want a solution that is more inclusive, where we are looking at covering everybody.
Yes,
and those who are in our rural communities who don't have these facilities.
Yes.
And so what is the backup for that? What are the alternatives that we have in case we don't have electricity? How do we power this? It's also important. Normally, innovation is more of a disruptive nature. It shifts us from a position to a different position. You can only get people to come along or buy your solution when it guarantees convenience, which I just spoke about. It provides safety. I can see you having these sensors. What is the guarantee health-wise? There's a bit of radiation, right? I don't know how it picks the signals. And so how do you guarantee that this will not also be counterproductive by probably causing another harm to babies and the rest? So these are concerns that you need to take care of when you are rolling out these things.
Yes, please. So with regards with inclusivity with underdeserved, like rural communities, we actually have a battery that actually wouldn't have to be powered, like charged. That means that mothers can actually just take out this battery and just replace them with just our normal batteries in our community stores. So the person has to just go and buy them and just replace them there. Then it still functions normally as it is. With the infrared sensor that you earlier spoke about, we know that yes, definitely even with our medications that we actually.
Let your answer be brief.
Okay, sorry. So with our infrared sensors too, it actually has a minimum infrared radiations, which would not cause any problem to the babies when actually it's picking the signals, it's picking the temperature of the babies. Yes, please.
All right. So Noel.
Yes, please.
Well done in your presentation. I want you to, as you go away, just think of how you would have answered the question on the impact this thing would make. Specifically, what specific impact this innovation would bring to newborn care. So just think about it so that when you appear anywhere else and you are asked that question, you'll be able to answer. On that note, well done, and we discharge you. Thank you. Please let's put our hands together for him. And we can invite the next person, who is Jennifer Amponsa.
I stand on all existing protocols. Good morning to you all. My name is Miss Jennifer Mponsa, a staff midwife from the Hackathon region working in the Gonsi Municipal Hospital. I'm honored to be selected to be part of the 12 finalists of the Midwife Innovation Hackathon Competition 2025. I believe that every pregnant woman deserves a quality antenatal care regardless of her location. In my past years in the Hackathon region, I realized that midwives in the CHIPS compound find it difficult to communicate issues pertaining their client that they receive at their point to the medical officer at the health center. There comes the idea of this maternal care app. With the issues concerning maternal care app, the Ghana Health Service stipulated that maternal health mortality rate increased from 109 to 1110 per 100,000 live births from the year 2023 to 2024, and this brought down the skilled delivery coverage from 60% to 55%, and also the WHO stipulated that the worldwide maternal mortality rate increased to 295,000 from the year 2017 to 2020. All these are the result of shortage of doctors in the rural compounds and also Issues like one doctor is to 100,000 patients at the rural centers. So on the maternal care app, these are the interface that you are going to find: patient interface, doctor's interface, and also the midwife interface. It's going to help them communicate to each other. The features of the app is having AI risk detection. It can be used offline as well, and a smart escalation alert, and also voice to symptom AI for the mother to voice out her symptom to the midwife, and also an SOS alert button that when it's pressed on, it will call the midwife's line for the client to communicate with her. These are how the app works. This is how the maternal care app works. Registration of patients, taking antenatal records, that is the past and present pregnancy history. Also with AI risk scoring, it's going to escalate all the danger signs for you to know that this patient needs an immediate attention, and M will also receive an alert for implementation to be made. And the impact and scale is going to cause early detection of high-risk pregnancies, also real-time alerts, reduce response time. So together we can save lives. I want to move on to my innovation. I'm going to use 3 gadgets, but I can't show all of it on it. So I'm going to focus on the midwife's interface and also communicate with the doctor here for you to see it. And also the patients will be communicating with me from the audience. Thank you. So right now, I'm going to log in as I'm logging in as a midwife. So that's midwife Jennifer Ponsa logging in. So on the interface, vital signs, appointments, registration of patients, high-risk score, interventions, prescriptions, ward monitoring, and also complaints of patients are seen there. MS reviews pending. So I receive a new patient. I register by capturing her fingerprint here. So patient's first name, Grace Yeboah. Her last name. Her age. Patient's phone number. Her address. This patient lives at Pomakrum in the Ahafo region. Her emergency contacts. So, when patients come to our facility, we run labs for her. So I assume this patient has done her necessary labs and her blood group is O positive. So I go to select. I ask her of her last menstrual period. So if the patient does not know her last menstrual period, the patient is going to take scan for it to confirm. So this patient said her last menstrual period was in July 3rd. So the app has calculated the EDD date for the patient. She is going to deliver on the 9th of April 2026. This patient's gravidity is para 2. I'm done registering the patient. So now I'm going to go to an antenatal visit. So new. So with this app, I want to demonstrate how it's going to alert the midwife to know that this patient is having preeclampsia severe preeclampsia. Yeah. So that's her blood pressure. After checking several times, I still recorded high. That is 165 with the systolic and the diastolic 110. Her hemoglobin level 2 is 10. We did RBS for her and we had 5.0 millimole per liter. There are other vital signs here. So her pulse is 80, respiration 18, temperature is 36.5. I go to the next phase. So after doing urine protein test for her, I had 1 plus of urine and also a trace of sugar. And also after running her labs, she was negative with HIV, her B negative, her rhesus factor is positive as she was O positive, VDRL is negative. I go to the next interface. So I listened to this mother's fetal heart rate. You can adjust it, you see. So I had 132 and I measured her fundal height. I had 20, her necessary assessment. So her weight too is 60. Her gestational weeks, it has already been calculated. That is the 23 weeks over there. I give her a folic acid. If I have any clinical notes, I input. If I do not have, I go to next. So right now, with my personal assessment, I can ask her, are you having headaches per her BPs? She says yes, she's having severe headache. Are you having blurred vision? This woman said yes, I take. Are you having chest pain or epigastric pain? She said yes. So after that, I saved. So after saving, that's the sound. High risk. So I go to my intervention. You can decide to book her next appointment. She's going to come in there 1 month time. I want to skip her prescription for now because this woman is not going to go home due to her condition. So I come to my intervention. Here is Miss Grace Yeboah, preeclampsia with severe features. I tap. So with the assistance of the AI, saying call for help. Position client at the left lateral side. I've done that. So you take, establish 2 IV lines. So I take all of it. Because of time, so I'm moving. So I'm also logging in as an MO. So I'm logging in as an MO, that is Dr. Apia Mensah. So you can see that there is one required immediate attention over there. Because I was not able to do it together, that's why you didn't hear the sound. If it was to be going together with that. So that's Grace Yeboah, preeclampsia with severe features. So when the doctor goes there, already the things that the intervention that the midwife has done has been cancelled for him to see. So he too goes on and also gives her orders. So right now, after the doctor has given her orders, the midwife will go back again to her intervention to see what the doctor has marked. So that's what the doctor has marked. So administer antihypertensive, arrange for emergency transfer, accompany patient during transfer. So intervention completed. So refer to the hospital. So the midwife will then also come So doctor will go to Grace Yeboah's review, and after his assessment, he decides to input something, refer to hospital, and this is the clinical note. After the administration of the loading dose of Maxoff, that's magnesium sulfate, to prevent fits. So, the midwives comes to the history. You see, refer to hospital. So the midwives goes here to complete, refer client to the hospital. So it's completed. So you can see that Grace Yeboah with preeclampsia, the severe features are being referred to the hospital. So with this one too, a patient from the audience will also log into talking to the midwife from the house that she is not feeling well. So there is a button. For now, we have an interface for you to speak as a mother that you are having headache or any complaints that you want to lodge. I want to log in with this one either. So the midwife, I'm continuing. Someone is logging in over there. So right now, okay, fine. So right now, I go here, I see a patient's complaint. Dr.
Hello,
Spencer.
Jennifer.
Yes.
Unfortunately, your time is up. You have done well, though, so we have some questions for you. Let's put our hands together for her.
Jennifer, thank you very much. So I just want to find out at what level would we be implementing or using this application?
Okay, for now, for our first phase, we want to start with the piloting at Macro Chip Compound, the Sumra Health Center, and also Bistre Chips Compound. The reason being that they offer maternal health care services and also they have good networks at their end.
Okay, I just want the level. So we start from the chip compound,
yes.
Right? Okay. So with this chip compound, when you pick the data from the chip compound, how, because based on this, You see that you have the temperature, you have this, we have that, and everything will be in the games or the EMR, the hospital management system, right? So how will you link this one to the hospital management system so that there will be continuity of care? That when the person goes to the hospital, they won't end up not capturing the whole data again. It will speed the process and make things better. Is the question okay?
Please come again.
So this one will be implemented at the chip compound, right? So you have picked a lot of data, and maybe there is a referral to maybe the district hospital. The district hospital is also using the games, the new software. How will you ensure that they wouldn't capture this whole data again?
And that's
to reduce the time, and there wouldn't be double capture of data, right? Okay.
Please, can I answer the question? Okay. With this midwife, she was communicating to an MO at the hospital. So with the biometric registration, it's not going to allow a double registration of the same client. So whatever that goes on here, the doctor at the hospital will be able to see. So we are trying to see if you link it with the already existing app that the hospitals are using at their places. That's what you like.
Right, Jennifer, thank you very much. That's a good one. You have identified what the problem is, and then you are clear on what you want to resolve. And you are going to start with the pilot, right?
Yes,
so you've explained why you're going to start from that place.
Why I want to start from that place?
Yes, where you're going to do the pilot, why you are selecting the particular location. You have explained that.
Okay. I'm at the municipal hospital. So these places are where we receive our referral cases from. And per my experience, I've realized that if that gap between the midwife and the doctor is being solved, it's going to help save the life of most mothers that comes to an end. Because at times when they come, you realize that this case would have been solved over there before referring. But at times, the midwife there do not want to put herself in any inconvenient situation because he feels that there is no medical officer over there. So she decides to refer the case without even at times accompanying the clients or even attending to the clients. But with this one, the medical officer will insist that you have to do this, come with the patient to our end. Thank you.
Okay, all right. Thank you.
Okay, Jennifer, thank you for presenting to us. Let's put our hands together for her as we see her off. So we are discharged. Now we invite Sandra Kobna. Let's welcome Sandra to give us some more vim. Sandra, note that you have 15 minutes to present, after which we would have 5 minutes with you question time. When you are asked questions, please be straight to the point and brief with your answers. All the best.
Good morning, Dr. Chairperson, all protocols duly observed, ladies and gentlemen. I am Sandra Kobina, a midwife at St. Elizabeth Catholic Hospital, Ahafo, and I am happy today to be here to present to you my innovation. So my innovation introduces an app called Her Mental. It is a screening tool for midwives across the country for early detection and intervention of maternal mental health issues. WHO defines health as a state of complete physical, mental, and social well-being, and not just merely the absence of illness. But what do we see here in Ghana? Our healthcare system is designed in such a way that we only focus mainly on the physical aspect and often neglecting the mental needs of our clients. As an individual who has been a victim of mental health crisis to the point of self-harm and suicidal thoughts, I have this passionate zeal to be a mental health advocate. Hence, this motivated me to join this hackathon event. So like I stated earlier on, Her Mental is a screening tool that is designed to help midwives with the early detection of mental health issues and then early intervention as well. So the technical depth of the app, it is built with PWA Next.js 16. So that is designed for low connectivity environments in Ghana. So this app, whether you are online or offline, is able to operate. And then the key features is that it's user-friendly and it uses an evidence-based tool. And then the steps that you need to use for this app is not complicated. So the impact of this app is to enhance maternal mental health, which will help with enhancing maternal and child health through early detection, intervention, and integrated care. So I'll go ahead and then show you my app. Oh boy. Okay. So I've already logged in as a midwife because this app is for solely midwives. So you access the app using your name and then your staff ID. So this is the interface of the app. It has the screening tool, the resources, educational resources that the midwife will use with regards to the intervention, and it has past records of clients that we've screened, and then it has the emergency crisis guide. So the guide, it has the emergency numbers. Once this app is accepted into our system, we will input the contact of the various mental health facilities across the nation so that referrals will be as quickly as possible. So now let's get into it. So over here, you input your client's name and her LIMS number, age, and the type of visit. So this is for all mothers. So whether you are pregnant, whether you've delivered. So for the sake of this demonstration, we are using ANC visit. So whether the client had any complications, so no. Then you click begin mental health check. So this is the screening tool. So it's a set of 10 questionnaires that the midwife will ask the client. So it talks about the emotional aspects of the mental health, the emotional aspect of the screening, and then the support system as well. So on to the next. So this client answered often to this question. What is income? So let's say these questions, the clients answered often to all of them. So the question 9 of the questionnaire is the most critical aspect. So over there, the client is supposed to, or is expected to answer to never. So if she answers to often or sometimes, it means that this is a critical situation and then we need to intervene immediately and at the spot. I think the laptop is slow, that's why. Oh boy. One of the challenges that this app is going to have is the fact that if you're using an internet, it has to be very quick and strong. So this was what I was talking about. This is the critical question of the questionnaire. So this, my client answered often. So this is a red flag. We do not want that. So you submit for scoring, and then the app automatically scores for you. So this client had 20 out of 20. So it has the interpretation here. So this mother has expressed thoughts of self-harm. So immediate psychiatric intervention is required. And below is the scoring. So from 0 to 7, as we can see here. So what does the midwife have to do? Recommended action. So you do not leave the mother alone, because when you leave her alone, she might harm herself. So at the facility, you press the call button and call the mental health unit at your facility so that they will come in quickly and then intervene. So my app has a feature where you can print out the results or save it for continuity of care. And it also has a note. Yes, it has a note feature where you can type in whatever care that you rendered for the client. Thank you. Yes, please. Sure.
That this app is solely for the midwives.
Yes, please.
And I see like there's a survey or a mental health assessment to which the midwife would use to evaluate the patient, right? Yes. My question is, what is your value proposition? Because I'm still struggling to understand why we need an app. If we have a central mental health assessment toolkit for the nurses to use, can't we find a way to integrate as part of maybe their capacity building or their training, that when the patient comes in or the pregnant woman comes in, they will be evaluated and know if they need help or care. But I'm seriously struggling to understand why we need an app to do this here.
Well, currently there's not a single routine in the system right now that the midwife can use to evaluate. So this app does that.
No, the questionnaire or your assessment toolkit is what is evaluating if there is a risk or not, right? Yes. But my question is, why does it have to be an app? Or why does it have to be installed in an app?
Because we are going paperless. We are using, we are in the digital world right now, so.
Okay, so I think the question is at the heart of what innovation is all about. Again, as far as mental health is concerned, there are a number of solutions. If you go to, you can find a number of apps. Probably the question is, what is different about these ones?
Well, this one will enable the midwife, right? When the client comes to us, it will enable the midwife to evaluate the client, okay, and then fish out the early signs of maternal mental health. Because as it stands now, we are not doing these things when they come for the visit. Please, do you get me?
So let me just make it very easy for you. So what integration plans do you have? If you do all those assessments, so what is the next step? What do we do then?
We refer them to the mental health persons because they don't come to us to evaluate the clients themselves.
Okay.
So it has to come from somewhere.
Okay.
To them.
All right.
Because there hasn't been a single time that, like, we even refer them to see a mental health person as maybe when they take scans and there are abnormalities, we take them to see the MO. So this is supposed to do that for us.
Okay.
Yes.
All right.
This one I have to ask you a follow-up question.
Okay.
So supposing you have a client coming for ANC, how are you going to use this app? Because the clients will come with the ANC booklet and all that. So just help me to understand how this fits in.
Okay, so if I win this competition, I'll try my possible best, collaborate with other organizations so that this app can be fixed into our system. That is the LIMS. We already use the LIMS. So that when they come, we just go to that area in the LIMS and then key in these things there. So it wouldn't be a separate something.
Okay. So currently, when if you have a pregnant woman come to you for booking visit, you use a booklet, isn't it?
Yes, we use it.
You fill everything.
Yes.
Let's say that you have this app and you are thinking of the mental health, maternal mental health. So you fill the booklet, then what happens with this app?
So for the piloting, we will have to use a mobile phone or the tablet at our work. So when they come, after doing the physical aspect, then we come to the mental aspect with this one. So this one saves whatever care and then everything that happened on the system.
Okay.
So we have records of that one as well.
All right. So now you know that there are some antenatal clinics that you can have as many as 150 or sometimes even more clients coming for ANC. What you are saying is that you go through the physical booklet field, then you move on to the app to do the mental health assessment.
Yes.
Is that what? Yes. And do you think that this is practical?
Yeah,
a practical thing to do, looking at time, and it also appears as if that the midwives are going to be given extra work. How do you see it being? Everything you've said is good. The mental health assessment, I agree that there's a deficit when it comes to the assessment and all that. But so that your app will not be developed and left hanging somewhere, can you help me understand with these things that I have said? The additional work, filling the paper and now moving on to this, for each client and for each midwife to do that.
Okay, so by God's grace, we've been able to integrate focused antenatal care into our routine system. So the rates at which, we have more midwives now. Well, my facility, we have like 4 consulting rooms, each with a set of enough midwives to attend to the clients. So if one person is doing this, the physical, the other people can also do the mental. Yes.
Okay. So I think that Sandra, right?
Yes, please.
Sandra has made good use of her time. As for the questions, we could have gone on and on and on, but I want to discharge Sandra, and I think we can put our hands together for her. But Sandra, just reflect on some of the things, the questions that we've asked you. It will help you going forward.
Okay. Thank you.
Thank you. So on that note, we would welcome Philomena Mensa. Philomena Mensa. Let's welcome Philomena. Philomena Mensah, you are welcome. Just a reminder, you have 15 minutes to present and then 5 minutes to answer some questions. When you're answering your questions, please be brief, straight to the point. All right, all the best.
Good afternoon, Dr. Chairman. All existing protocols observed. My name is Philomena Mensah, a senior staff midwife at the Greater Accra Regional Hospital. My innovation is the KMC Mama Circle. KMC simply means Kangaroo Mother Care. So KMC Mama Circle is a digital support app that gives preterm and low birth weight mothers a simple step-by-step guidance on how to care for their preterm babies at home. So every year, thousands of preterm babies die, not because die from preventable causes, not because the mothers do not care, but because they lack simple real-time guidance and then support. So our app simply helps preterm mothers to be able to get the necessary information and then to help track the progress of their preterm babies. So what the innovation is about? So this is simply a digital support platform app that helps preterm mothers to be and guide them to be able to care for their preterm babies at home. So the problem that led to the development of this app is we realized that most of the preterm mothers lacked, they had low confidence and anxiety. They had inconsistent education and follow-up support, which led to discontinuation of KMC adherence at home. There was late identification of danger signs, and they had challenges with feeding at home. There was also limited male involvement in the care of these preterm babies. So the mothers were being discharged home with limited guidance. So the solution is simple: a digital platform that gives KMC mothers 24/7 step-by-step guidance on KMC practices, breastfeeding, weight monitoring, feeding, hygiene, and the knowledge on danger signs. So how the innovation reduces neonatal mortality? The digital KMC Mama Circle app directly contributes to reducing newborn mortality by strengthening caregiver knowledge, early detection of danger signs, improving feeding practices, and then improving adherence to KMC practices. Research shows that a well-supported KMC can reduce mortality by up to 40%, and this is what our app seeks to display. So the scalability, it can be scaled across NICU facilities, community health facilities, districts, regional and teaching hospitals. So this means that KMC Mama Circle app can easily go nationwide. So I'll go ahead and then display how this app works. So the app has two logins. So a login for the midwife and then a login for the mother as well. So I'll go ahead and then log in as a parent. So this is the interface when the mother logs in. So the mother will be able to track her KMC session, her baby's feeding, weight, and then daily check-in. So the daily check-in helps the mother to check in her emotion. So it deals with the emotional aspect. Let's say, how is baby doing today? So baby is calm. How are you feeling? I'm feeling less anxious. and today's win. Maybe let's say today my baby gained weight. So the mother will be able to log in and then track her KMC sessions, her feeding, and then weight loss. So I'll just log out and then log in as midwife. So with the mother interface, the mother will be able to track, learn something about danger signs. So these are the danger signs grouped according to breathing problems, feeding problems, temperature problems, infection signs, jaundice, and then emergency signs. So once the mother notices any of these signs on her child, she will be able to contact her assigned midwife or nurse to know what to do. And then we have a session for KMC for moms and dads. So it's just a corner where the mothers can meet and then share their experiences, challenges to help them, and then to help the new mothers as well, and then to help them relieve anxiety too. So there's a session where the mother can learn information about KMC, breastfeeding, hygiene, support, and then safety. So we added the dad corner just to encourage the fathers to take part in the care of these babies. So I'll sign in as a nurse or midwife. So once I sign in as a nurse or midwife, this is what will show. So the active babies in my care. So I'll just tap on this baby, and let's say if baby has been discharged home, whatever information her mother logged in, I'll be able to see it here. This will help me to follow up on baby's progress at home, and then it will be able to let me know how baby is doing at home. So let's say, for instance, if the mother logged in a temperature of 35.2, I'll get an alert here. That's the danger sign. I'll get an alert here indicating that this baby has a temperature of 35.2, so that I can either call the mother and assist her on what to do, or I can call her and tell her to take baby to the hospital, depending on the other signs and symptoms the mother will communicate to me. So I can also sign in as an admin. So the admin is able to get information on all babies in KMC care, babies who have been discharged and babies who are ready to be discharged. So the admin can assign a nurse or midwife to a mother, or the admin can be able to admit new babies who are being referred from other facilities to the NICU unit. Thank you. This is all about KMC Mama Circle. Thank you.
Straight to the point and answer.
Thank you, Philomena, and once again, well done. I want to, first of all, talk about your problem statement. There's a gap that you have seen, and you want to build upon that, increasing this innovative idea or this innovation. And we all know that data helps us to implement best decisions or implement best practices. But in your narration, you said most, and I don't quite get the most. So how do you arrive? That most of the mothers that are discharged, and so I'm lost. So if you can give me, that's how come you're able to implement this. Because you said most of the mothers complain, and so where's the data that made you come out with this? Because it's a very good innovation, but then the day, data would help you, get this. So if you can give me, if there's a pilot that was done, a survey, all that will help. That's the first. Okay, so you answered that, and I'll move on to the
so
next.
actually what led to the birth of this, the development of this app was that I realized when the mothers are being discharged, or especially when the mothers are on admission, at my unit, we have a separate unit for kangaroo mother care. So once the babies are being moved from NICU, they come to KMC unit. So when they come, this is the time where the mother, for the first time, will be with the child. So most of the mothers are anxious, and then they lack the necessary support. Some of them, they'll be staying at the hospital. No family members will come and visit them. So majority of them are anxious. And then they are even scared of how to take care of these babies when they go home. And then some of them too, there was late identification of danger signs. And most of the mothers sometimes call us and then tell us, let's say the baby has passed on or something. So when you probe further, you realize that there were some danger signs the mother could have noticed and then bring the baby to the hospital for timely intervention. But because she lacked the necessary education and information on these danger signs, she stayed home and then thought it was something normal and decided to manage on her own until it became critical. When they rushed baby to the hospital, unfortunately, baby couldn't survive. So most of the neonatal deaths we get, majority of the mothers, they lack knowledge on danger signs. And then another problem was lack of family and partner involvement in the care of these babies. So when the mothers are on admission, sometimes when you call their husbands to come, they don't want to come. It's like they don't care about whatever is going on. So we decided to create this app or this circle in order to encourage the fathers to take part in the care of these babies. Thank you.
Okay, so what I want to say is that the idea is great, but I'll keep on repeating data. Okay, so the fast forward, can they do a survey or something so that you're able to have the data that will help to implement this project? You can tailor it down. Thank you.
Thank you very much. So, my question is on looking at this nice project. What do you think will prevent its scale-up nationwide? Looking at this nice project, what do you think will prevent scale-up of it?
Okay, so I think with the scalability, what will prevent the scale-up?
The adoption of it, the scale-up.
Let's say in facilities where there are no NICUs or KMC units, I don't think they can, but they can, because once in a facility there are other, like let's say preterm babies can be born in any facility, so they will just have to refer the babies to units with NICU units. So for them, I think the midwives will be able to adopt this app. And then once they are being referred, when they refer the babies, you'll be able to get or know the information or whatever input they did before the babies were being referred.
Okay, thank you very much. So I also like to just touch on basic things with terms of your design. I like where you have three interfaces: the mother, the baby, the admin dashboard, which is very great. I will also recommend that let's have more pictures. It should be more pictorial than more of the text. Looking at it being a new concept we are introducing, people would like to see and follow steps very well. And let's have a portion for resources, where maybe we can watch a video, we can watch some illustrations, we can have some text. Thank you very much.
Thank you. Just to add, there are also some portions that maybe you can have options, a drop down, where they can choose the options and give room for some options that may not be there. So where you were looking at, I feel anxious, typing all that, you could give options that you think would be frequently experienced, then they will choose that. On that note, well done, and you are honorably discharged. Let's put our hands together for her.
Hello. Hello.
Our next innovator.
Hello. Hello.
Let's welcome twin innovators, Edna and Linda, Edna Befi and Linda Mensah. Let's put our hands together for them.
Hello.
They are not biological twins. So Edna and Linda, you have 15 minutes to present, after which you have 5 minutes of interaction. Do well to make your responses brief and straight to the point. I wish you all the best.
Dr. Chair, all existing protocol. I am Edna Bercy, a midwife, Ghanaian Municipal Hospital, resident of Ghana College of Nurses and Midwives, where women care faculty.
I am Linda Mensah, Achimota Hospital, midwife, Ghana College of Nurses and Midwives, where women care faculty. Thank you.
From our experience of field of work, we have encountered a lot of mothers who have used herbal medicine without knowing the effect on this herbal medicine. I have this personal experience with a client I would like to share with you. I had a client who was an advanced maternal age who treated infertility for quite a long time. For the pregnancy, she went through, I was the care provider, she went through the pregnancy journey, almost 39 weeks. We were there one day, she was rushed to the facility, and the question was that the mother-in-law introduced her to a herbal leaf, specifically pawpaw leaf, for an enema with the intention of hasty labor. This woman bled, she lost the pregnancy, we lost her finally. So this motivated the idea of Save Mama Plus. So what are some of the reasons why our mothers use this herbal concoction? They use it with the reason that it is affordable to them, their tradition and culture. It is also low cost. It is due to inadequate knowledge on the effect of this herbal concoction, and also accessible to them. They can easily get access to it. Save Mama Plus, it is an educational app which will create an awareness on unsafe use of herbal concoction. On this point, I will leave my sister to show us the demo on our Save Mama Plus.
So with the Save Mama Plus, you know, our mothers, our pregnant mothers, they are our heartbeats. We value them so much. We don't want to lose our mothers. We lost one this year recently. So the UNFPA is saying that every pregnancy is wanted, every childbirth should be safe, and every young person should be able to achieve their potential, fulfill their potential. So with this, that is why we brought up this innovative app. That is the Save Mama Plus. So it has about 5 features. We have the AI Snap and Verify. We have the Herbal Garden. We have the Check Truth. We have the Ask the Midwife. We have My Journal. So we will go deeper into it and show the demo. We are getting started. So I want to walk you through the demo. Let's all follow. So we are going first of all with the Herbal Garden. So the Herbal Garden is a database displaying various herbal medications. So we have the ginger, we have the raspberry, we have the pawpaw leaves, and we have the blue cohosh. So with the Herbal Garden, we have the search bar. that you can input the help that you are looking for. So, hello. Let me input pawpaw leaf. All right, so we have the pawpaw leaf. So I'm typing pawpaw leaf. So when you input the pawpaw leaf, every information about the pawpaw leaf will be displayed. They use the preparation, whether it is safe or unsafe, the local name, Bofre, and then the botanical name as well. One interesting feature about the herbal garden is it has the audio feature. So with the audio feature, I'm tapping on the pawpaw leaf. Then English, the languages. We have the Chi, we have the Ga, and we have the Ewe. So you tap to listen to the language. So this one is in Ghana. So we are changing the language to Ghanaian language and to G. Sorry. You know, it's playing. We should all follow, please. Very, very interesting. Can we all hear? This is G. That is in G. So we are going to Ewe. Ewe to So with the herbal garden, we have all these languages, about 4 languages built in. So we are going to the truth check. The truth check has a color coded tags. That is the red and the green. So the red contains the myth. So the myth is this leaf makes the baby slide out easily during labor. That is the myth. So let's check the truth. You tap on the myth and it will display the truth. The truth is this leaf causes the womb to squeeze hard, which can distress the baby and cause rupture of the uterus. That is the truth. So we are going to the other feature. Ask the midwife. About the Ask the Midwife is a chat-based feature that you can communicate with your midwife. So you send a message in the chat box. Hello. So when you type hello, within 24 hours, the midwife should be able to respond to this message and give you every information about the help that you are looking for. So we go to My Journal. My Journal, interestingly, has some emojis. It has the great, okay, not good. So My Journal keeps record of the client's symptoms, and then it keeps data of the client. So how are you feeling today? Then the client will respond, maybe good or okay. Let me tap on okay. Any symptom today? Nausea. Then I will tap on the nausea. That is the symptom. Did you take any herbs or medication? Then you type no. Or if yes, which medication? Ginger. Then your symptoms will be collected. So if the symptoms are mild, then anytime you go to the hospital, you can show your symptoms to the midwife. And if she has any idea about the herbs you are talking about, then if you took any herbs, but if you did not take any herb, any advice will be given to you accordingly. One major feature that we want to showcase is the AI Snap and Verify. The AI Snap and Verify. Now we want information about the herbs. So this one is pawpaw leaf. Currently, the app is built with pawpaw leaf, ginger, raspberry, and blue cohosh. So I'm coming to capture the pawpaw leaf. Light. You're able to demonstrate. Now it is analyzing the leaf. So this one will analyze the leaf and display every information about the leaf, the facts, the myth, the Ghanaian language, the name, the botanical name, how it is being prepared. So it will display every information about the leaf. So if our pregnant woman does not understand that leaf, she can go back and ask the midwife. Ask the midwife, is this leaf saving pregnancy? Then this midwife will respond to it within 24 hours. Thank you very much. So it's still analyzing. It will capture and every information will be displayed. Yeah. All right. She has finished analyzing every information properly. Avoid. It is not safe to use in pregnancy. Thank you very much.
Thank you. Now you are ready for your questions, isn't it? Okay. Thank you very much for that wonderful presentation. I think for me, my question is, does this app overall support herbal use or not? Is it safe for consumption for pregnant women, or it's still always flag risk once someone is taking these herbs?
As now, Ghana Health Service and Ministry of Health has not actually given a herbal medication that can be used in pregnancy. Most of our herbal leaves medication are teratogenic to pregnancy. Some of them will have this oxytocin effect that can cause the uterus to contract persistently, leading to persistent labor and sometimes lead to bleeding, postpartum hemorrhage, ruptured uterus. Some too, mostly when you use it, it causes abortion and all.
All right. And this herbal concoction medication too, some of them too can cross the placenta barrier. That is harmful to our fetus as well. Thank you very much.
So does it mean that regardless of the app the plant you scan, is definitely going to advise you not to take it? Or there will be situations where it could... Would that be the same for the ginger?
The ginger, sorry, you can.
The ginger is for nausea management. So we are not saying all leaves yes,
you are not.
So,
okay, great. I just like your energy.
Thank you.
Right. So let me just start by saying, even the general phones that we have, if you take pictures of any leaf or any of these things, and you put a prompt there, they're able to tell you all these things that you need. But the version that is of interest to me is the local bit that you've added to it. So I think that is where the innovation is. So you need to build a base on that. Maybe a research will do the typical herbal stuff that our women or our mothers are taking, and so that becomes the foundation of whatever you do. Else, the general thing that any leaf that you put up there, the phone is able to tell you this is harmful, you can use this for this purpose and stuff. So kind of amplify the local bits and make sure that you capture our content as Ghanaians. It makes it more a homey solution. Yeah.
So we want to take this innovative globally. So the languages currently, for now, these are the 4 languages we have. So as time goes on, we will have various languages. That we will have the French, the Spanish, whatever language. We want to become like the doctor. We want to take it global. Yes.
All right. So my next question is very, very interesting. So what are the immediate plans? Okay. So after these one, what are your targets? Are you doing a pilot? How do you want to scale immediately? What do you have in mind so that we also start thinking about it?
What we have in mind is that we want Save Mama Plus, so that we all investors, everybody Save Mama Plus, so that midwives will be trained on this herb, so that they can also, it is an educational tool, so they can use it during pregnancy school, antenatal sessions, community debates, so that everybody will know and have knowledge on some of these herbs that are not safe in pregnancy.
I think one last question with regards to the app. It's just a recommendation that I know that KNUSC has a herbal and plant medicine. Maybe you could get a consultant or someone who could give you more insights on the herbs, because I know that some people still go through the traditional approaches and it's still working for them too as well. So I think that's more one add-on. And then secondly, I know that your target audience is the pregnant mothers, but have you considered mothers or nursing mothers too as well? Because the concussion, it runs through even for the infants too as well.
Thank you very much. Just one thing, let people know the magnitude or the seriousness of the issue, because you may think that using herbal preparations during pregnancy is a huge problem, or you may think there is no problem. So you need to get that evidence to also back it, so that when you are speaking, you can show the evidence that this is something that we need to look at. So that's just another recommendation. Thank you. And you are discharged.
Thank you.
So at this point, we want to invite Dr. Jemima Dennis Entry and Judith Bentel. Let's put our hands together for them. So you have 15 minutes as usual and 5 minutes for questions. All the best.
Dr. Chair, distinguished personalities, fellow midwives, ladies and gentlemen. Indeed, it is the pleasure of the Center for Health Development and Research, co-applicants with Judith, our mentee, to make this presentation on the Obatanke Mother Link. I will be her support base. Thank you for to the organizers and also to the Ministry of Health and UNFPA. She would make the presentations and then together we'll take the questions. Thank you.
Again,
I am Judith Benso, a midwife. Today I present to you Oba Time Care, the midwife link. So, this stems from the fact that I work in the district facility in the Bongahafo region, then now Buno region. We have a lot of CHIP compounds around us. I'm in the district hospital. So, as at now, we have 28 newborn deaths. And then during the audit, we realized that we have about 70% of them coming from the referral facilities or the periphery centers. In our near miss and then death audits or reviews, something's come up. And it's like, I didn't know I was supposed to do this. I didn't know I was supposed to do that. I was the only person alone. Then we decided, we reflected, what can we do to help give a real-time support to midwives in the periphery? So we came up with this. We want to have a healthy mother with a healthy baby. The following system I have already mentioned. We have high maternal and newborn morbidities due to limited decision making support, and they also have delay referral and their communication. They have poor data. Data is very important in our work or field of work. We are proposing to you a digital decision support platform called the Midwives Link, Oba Time Care. So Oba Time Care, again, the Midwives Link. It is going to give us a real-time decision support. It's going to guide the midwives, facilitate rapid referral, and it's going to promote or provide strong reporting dashboards. All this has been said in our proposal already, so I want to skip. Scalability. We want to look at it from the point of CHIP compound, entry into our district, regional, and then probably a national expansion. It's going to be an offline first for rural areas, so that when we build it up, then we can decide what to do. They want to integrate into our DIM, so we have adequate data for our system and then for policy formulation and then implementation. They also want to, if the app is promoted, we want to also have models comparison ANC, postnatal, family planning, all of those. So it's going to equip the midwives day in and day out through us. The sustainability plan, we look at integrating it into our Ghana Health Service digital roadmap, continuous capacity building as we have new rollouts and roll-ins each time, training of trainers, and the partnership with donors and stakeholders for long-term funding and then support. So this is the basics of the Oba Time Care app, the midwife link. So on arrival, you have clinical arrival, you screen, risk assessment, real-time decision guide, referral if any, hospital alert. The receiving facility also gives a feedback loop to the CHIP compound or health center. Let's go through our app. So it's a web line-based app. So this is the interface. I have an account already, so I just log in. And so this is our dashboard. At any point in time, you need to register a patient. You register a patient, you just have the details there. So I go to my patient management and I pick my patient. As it's open, it's going to give us an interface where I'll get a chance or opportunity to register my patient. I come to new patient. As new patient, I register my patient and then go on and assess the patient. I have patient's first name. And date of birth, I can choose from the calendar or anywhere I want to choose from. Automatically, it gives us the age of the individual. Phone number, if you have, you put. Important. And where the person is coming from, so I can track real-time data if there is a need to. The person has a health insurance contact, you can also put it optional. Gravidity is very important in any obstetric history. So let's say gravidas 3, para 2, or say para 1, abortions 1. LMP 13 for
So medically, we have the gestational age, the 7 days of delivery, and then the time the patient is coming. So they give you a summary of it. As the registration, so I have a summary of it. So assuming I have it already, then I come to assessment. I just pick any questions I want to pick. And I want to assess this patient. So I come to my facility. I'm a Nwasi chip compound. So I delivered. So I just put in my BP as I had recorded. Say 120. Pulse rate says 67. Temperature 36.5. Respiration 12. So no need for further height and stuff. Mode of delivery, vaginal birth. Yes, so amount of blood loss, I calculate around 250 to 500 mils or 500 to 750 mils. It's giving me a real-time decision making. Any other ODQs or complaints? Yes, so she's having headache, she's having vaginal bleeding. Postpartum hemorrhage. And what are we supposed to do? So immediate action. Call for help. We should establish IV line if there's no access. We should keep patients in lateral position if possible. Monitor vital signs and then prepare for referral. But then as midwives, we have autonomy to practice at each level. What medications shall we give? It's going to give us medications. Administer oxytocin. Then you go through their routines. If it doesn't work, let's look at misoprostol. The app is going to give us all of those things in real time. Then it tells you that even before referral, you have to do continuous assessment and then monitoring. About time care app says that if you do continuous bleeding assessment, look for our 40s and then we intervene where appropriate. Continue checking vital signs, urine output monitoring, and then keep on quantifying blood so you can give adequate history and then examination findings to the receiving end. It has to refer urgently because it is needed. So your referral, it gives you a decision. Referral decision, refer. There's a small box here you need to tick so that it tells you that yes, or it tells the app that yes, you've agreed to refer, therefore you want to put emergency refer. But because I've not ticked on the app or click on it, it tells me I want to refer this patient to another facility. Recommendation based on risk management. Warning is very important. Clinical assessment recommends referral, but you have not referred. Put in the reason why you should not refer. So even if it's like the woman says, I'm not going, you have an evidence that you referred. The woman said, I am not going. So you type in whatever you want to type in. But then if I click yes, it means I'm taking action and then I'm referring. Then again, we see that in referral, we have poor communication between the facilities. So let's say I'm choosing a district hospital to refer to. Urgency is very urgent, so I pick urgent and immediate. It gives me ability to choose my facility and everything is there. Then transportation. Transportation, which am I going to use? Is it an ambulance? Is it a hospital-based facility? Anyone I'm going to use, I choose. Then I type in the details of the provider. I type in the vehicle number. I also type in the driver's name. It's optional. Then if there's any notes, I also input in. Upon putting everything in, we realize that it's telling me that from my chip compound to the receiving facility, it's taking me 7 minutes to get there. So, About Time Care app is giving us a real time in everything we are doing. The moment I click on complete assessment, it's incomplete because the referral form is not adequately filled. Client has not consented to the referral. So it means client is not left out. We need to educate client, counsel her, create awareness. She agrees, then we hit on the button and then we refer.
So when I hit on the, if I'm able to fill the form well and I hit on the complete assessment, then the information and everything is sent to the receiving facility in a form of SMS. So by the time the person gets there, everything is sent to the receiving facility. You know the patient before you receive the patient. It gives adequate documentation to the receiving end. That is it. And they know I'm supposed to get there in 5 minutes. 5 minutes time, I'm not getting there. They can follow up. Facility B, you call me, a client is coming. It's past 10 minutes. The person have not read there. Any problem? Yes, ambulance got stopped. We didn't get vehicles. This, that. Then we can make amends for all of those efforts, and then we can take care of our patients to prevent delays. Thank you.
Some questions for you.
Thank you very much for your presentation. That was a very detailed one, and I like the fact that it helps in the decision support. So based on what you enter, it tells you what to do. It's very good. My question is, why web-based and not any other platform? So based on that, maybe I would like to follow up with other questions.
Thank you. So it is a prototype. That is why it is a web-based something. We in future, as a mobilizing fund, get adequate support. We are going to make it a mobile phone app that is accessible anywhere and anyhow. Thank you.
Okay, thank you very much. So, looking at the solution and where we are starting from, I believe that starting with a mobile application offline will be more helpful because at the chip compound connectivity level is very low. Number two is about the devices that people will use. Anytime that you go a web-based, then it's advisable to have a very good screen and a bigger screen, which calls for laptops, desktops, which they might not have. Number three, we also look at how we will avoid double entry of data. So that is my major concern. So this whole thing also will be captured in the paper. How do we take off the paper, or how do we avoid that the nurse will not capture here and capture there at the same time? And so my recommendation is that it's very brilliant at this level. If we could move away from a web interface into a mobile application that works offline, it would be very, very advisable going forward. Thank you.
Thank you.
Add that as part of the presentation, we indicated that we need to work with the wider district health system. So it's going to be linked to the DIMS so that it can also be a source of data gathering in order that information from the CHIPS compound can be
Thank you for the presentation and well done. I want to look at, as a great innovation, I want to look at the impact. So with regards to this innovation, what are some of the limitations that you foresee in the implementation of this great innovation?
Thank you. So we've also sat down to reflect on the app and then its functionality. However, we think or we anticipate that tracking will be an issue or be a limitation. So we are also looking at it from the point that when we do capacity building on continuous training, creating awareness and sensitization, and then putting the context of our noble midwives, we will be able to use the platform adequately to achieve its purpose and help newborn and maternal health.
Another challenge that we anticipate is the fact that this is an innovation that if it is workable, we need to expand or scale up, maybe looking at an entire district and then also moving to the new. So it means that this is not an innovation to sit only at the chief zone. We need to bring our stakeholders on board. So working with the DHMT, working also with the regional health management team, it is important that we get other stakeholders, for example, the district health information officer informed about the strategy. We need to get our district head of midwifery to be on board, because at the end of the day, if we are able to create a strong network of care, even at a district level, and get all our CHIPS compounds together, it means that at that level, it can be impactful, and the lessons learned.
Okay. I want to just add one more. Looking at what's the timeline, the time frame for this?
As part of our proposal, we indicated that we are looking at a minimum of 1 year, a maximum of 2 years to make an impact. So we look at a 3-month sensitization and capacity building of our midwives. And also we look at then selecting 2 districts within the Bono region. That is where she works, and she will be leading on the effort. So we look at 2 districts in the Bono region, work with the BHMT to select CHIPS compounds which have a bad maternal mortality rate or PPH history, and use that as our pilot project, based on which we will scale up, learning from the lessons.
Thank you.
Thank you very much. And I think that I'm curious, how many minutes will it take to fill a form? It was quite lengthy. So you take a typical nurse. How many minutes will it take a typical nurse to be able to fill this?
So 5 minutes, a typical nurse should be able to fill this form. A midwife should be able to fill this form. But you realize that you'll not be keying in a lot of features. Most of them are like the templates, you just need to hit the button. There are few places you just need to type something, and even those ones are not mandatory. However, the adequate ODQs are there for you to do.
Yeah, so when you were filling, you realized that it was incomplete, but there was nothing showing where the problem is coming from. Yeah, so it's one of the things that we must work on. And so the functional requirement and the system friendliness is something that we must work on. Thank you. Right. And we gather a lot of data here. Car number, one number, one number, one number. So you must make sure that you have your data protection registered, so that you'll be at peace when you are gathering sensitive data.
Okay.
Great. I think we can give them another round of applause. And we are honorably discharged.
Thank you, ma'am.
So we move on. We are gradually getting there. So I want to invite Frida Asante Esuma. Frida. Eswama. Frida Asante Eswama. Let's put our hands together for Frida Asante Eswama. You are welcome.
Thank you.
You have 15 minutes to present and 5 minutes for questions. All the best.
Dr. Chair, all protocols observed. Ladies and gentlemen, I count it a blessing to find myself here to present on my innovative idea and a project. Not long ago,
I spotted 4 of my colleagues at our nursing station, and they were discussing an interesting topic. They were saying, why are maternal death and infant mortality are not decreasing, despite the significant efforts we put in place as health workers, not even to count of the government and other organizations? One of them said, our clients are still having knowledge gaps in health. That's leading to their poor health-seeking behavior. Another one said, despite the existence of free maternal health care services and the NHIS, mothers do spend a lot on transportation and even their upkeeping when they get to the health facility. One also said, why do you expect them to leave their duties behind and get to the health facility, join long queues, and get back home if the symptom is not at the dying stage? And then another one said, because of distance, that's why they are not getting here, and they get here on time and getting poor health maternal outcome. And this represents a problem statement to us. Due to low access and patronage of reproductive, maternal, newborn, and child health care services is the main contributing factor leading to the rise in maternal and newborn mortality. And these are not just problems. It's having effect on us as a nation. The surviving family members and caregivers are facing mental health disorders. People are living with depression and anxiety, and even not to talk of grief complications. Also, because people are reducing trust in our formal health system, they are seeking